काही जास्ती काम नाही आहे.
So welcome everyone on this third day of the 3-day international e-conference on the role of sports psychology and fitness management for sportsmen during COVID-19 pandemic era. To take the sixth session, technical session ahead, I call upon Dr. Vijay sir, Principal, Jyotiba College of Physical Education, Nagpur, to take this further. Sir.
सिक्स टेक्निकल सेशन के चेयरपर्सन डॉक्टर गौरी चक्रवर्ती मैम, इनका रिज्यूम में थोड़ा सा संक्षिप्त में पहचान करना चाहता हूं. प्रोफेसर गौरी चक्रवर्ती, वर्किंग इन इंदिरा गांधी इंस्टीट्यूट ऑफ फिजिकल एजुकेशन एंड स्पोर्ट्स साइंसेस from last 30 years. She is head of team games and her specialization in game Kho-Kho. She wrote book on game Kho-Kho. She teaches educational technology and teaching techniques in physical education and coaching Kho-Kho game. She conducted national and international conferences, workshops and seminars. She published number of research papers in national and international journals. As an artist from last 35 years, she is providing her services in art and culture at Delhi Rangmanch and in feature films, short movies, web series, ads and social motivational videos. डॉक्टर गौरी चक्रवर्ती, आप प्रोफेसर करके इंदिरा गांधी इंस्टीट्यूट ऑफ फिजिकल एजुकेशन एंड स्पोर्ट्स साइंसेस दिल्ली यूनिवर्सिटी में पिछले 32 ईयर्स से आप वहाँ पर टीचिंग प्रोफेशन में हैं. आपका एजुकेशन बैचलर इन आर्ट्स एंड मास्टर इन आर्ट्स हिस्ट्री ऑनर्स आपने दिल्ली यूनिवर्सिटी से किया है और आपका बैचलर ऑफ फिजिकल एजुकेशन और मास्टर ऑफ फिजिकल एजुकेशन पंजाब यूनिवर्सिटी से आपने पास आउट किया है. आपकी पीएचडी मास्टर ऑफ फिलॉसफी की डिग्री आपने रानी दुर्गावती यूनिवर्सिटी एमपी से की है और आपका स्पेशलाइजेशन फाउंडेशन ऑफ फिजिकल एजुकेशन, फाउंडेशन ऑफ प्रिंसिपल एंड फिजिकल एजुकेशन, मेथड इन फिजिकल एजुकेशन. आप रिसर्च पीएचडी के गाइड भी है और आपने बहुत सारे, पहले ही बताया कि मैंने आपके बहुत सारे रिसर्च पेपर्स इंटरनेशनल कॉन्फ्रेंस और इसमें आपने पब्लिश किए हैं. रिसर्च पेपर पब्लिश इन रेफर्ड एंड पीयर रिव्यूड कॉन्फ्रेंसेस. यही आपका शॉर्ट में मैं इंट्रोडक्शन करता हूं. और आज के रिसोर्स पर्सन है सिक्स टेक्निकल सेशन के रिसोर्स पर्सन हैं डॉक्टर बिनायक कुमार दुबे, असिस्टेंट प्रोफेसर डिपार्टमेंट ऑफ फिजिकल एजुकेशन, बनारस हिंदू यूनिवर्सिटी, वाराणसी. आप पिछले 10 साल से यहाँ पर कार्यरत है. आपका पूरा एजुकेशन बीपी, एमपी, एमफिल और पीएचडी आपने नेशनल इंस्टीट्यूट ऑफ फिजिकल एजुकेशन ग्वालियर एमपी से किया है. आपका डोमेन ऑफ इंटरेस्ट फिजिकल एजुकेशन, एक्सरसाइज फिजियोलॉजी, टेस्ट एंड मेजरमेंट और डाटा एनालिसिस, फिजिकल एजुकेशन, रिसर्च स्टडीज, योगा स्टडीज एंड डिजाइनिंग एंड सैम्पलिंग ऑफ स्टडीज. आपको बहुत सारे अवार्ड से नवाजा गया है, एकेडमिक और प्रोफेशनल अवार्ड्स, जिसमें awardee of Junior Research Fellowship from University Grant Commission, New Delhi. Number 2, awarded Young Scientist in Asia Pacific International Conference Sports and Exercise Physiology, Exercise Psychology 2013 में for research work in the field of sports psychology, organized by the Department of Physical Education and Sports of Dr. Ambedkar College, Diksha Bhumi, Nagpur, Maharashtra. Chaired scientific session during National Conference on Exercise and Hypokinetic Problems in Modern Days, organized by School of Studies in Physical Education, Pandit Ravi Shankar Shukla, University रायपुर. आपके बहुत सारे पब्लिकेशंस है, 19 पब्लिकेशन आपने, बुक्स भी आपके है, रिसर्च प्रोजेक्ट भी आपके नाम से है. ऐसे महानुभाव आज हमारे बीच में करके है डॉक्टर विनायक कुमार दुबे. माइक अपने कंपेयर करता हूँ. थैंक यू.
मैडम आप
Dube sir, you can unmute yourself.
Can I start, ma'am?
Yes, please, sir.
Okay, thank you so much. Most respected Chief Patron, Honorable Shri Dilip S. Dave sir, President Krida Mandal Nagpur. Honorable Shri A.K. Gandhi sir, President Nagpur Shiksha Mandal. Honorable Shri Dhananjay Mane sir, Director Higher Plus Technical Education Pune. And Organizing Secretary Dr. Tapan Datta sir, Sanjay Chaudhary sir, Dr. Madhvi Madlikar ma'am, Principal sir, Vijay Daktare sir, Dr. Gauri Chakraborty madam, and other guests and resource persons, those who have joined from different parts of the country, and the listeners. Thank you so much for giving me this opportunity for sharing my presentation related to yoga, and especially the topic which has been chosen by the organizers. Really, I'm very thankful that they have chosen such a nice, because post pandemic it is very important for us to discuss these things, right? So my topic is what I have selected for today's presentation, that is the role of yogic science in fitness management during COVID pandemic. Okay, so what will be my flow of presentation? My flow will be in 3-dimensional. What I'll be doing, I'll be taking the help of yoga literature. You can see here in the first dimension that what the things have been mentioned in our ancient literatures. And then from the second angle, I'll be talking about the research findings, that what are the different researches has been already conducted, that I will discuss, and what are the different variables that have been chosen for doing this research, keeping in view this COVID. Everything will be centralized towards this COVID. So that will be the second finding, second angle. And in the third angle, I'll be discussing the scientific explanation, that what science says, that what is the scientific and the physiological reason behind it. This will be my flow of presentation. Right. So let me start with the first angle, and this is my, you can say, the controlling or the guiding slope which I'll be taking from here, and I'm taking the help of Patanjali Yoga Sutra, that is from the chapter 1 and 33 page, that is regarding the Parishmad, that is known as, and what it says. Okay, and this is the Sanskrit text. I'll be explaining in English also, and I'll be making relationship with this. So what it says, that this sutra says that Maitri Karuna Mudit Upeksham Sukh Dukh Purna Apurna Visham Bhavanat Chit Prasadam. Now here the sage Patanjali, he has mentioned about the different type of people. Okay, I have just shown this in the tabular form, the above slope. That is, he have mentioned that the different type of people, or you can say the qualities of the people, and what the qualities are. That is sukh, or you can say happy people. You can say those who are unhappy, those who are good and virtuous. In Hindi, it is known as pune. And the fourth one is the evil, right? So what he says that what type of approach one should have toward the people. For what? The question is why you should do this. The reason is for getting the peace, calmness, serenity, tranquility, clarity, etc. in the mind. Now, this is the punch point, that is for clarity. You can say for peace of the mind, this type of things can be followed. So, what are the approach? What Sage Patanjali has given? He says that if someone's quality, or you can say the type of people, if he's a happy nature, you should do friendship with him. If somebody is in happy, what you should do? You should have mercy on him. If somebody is in good and virtuous, you should be glad, you should be feel proud of him. And if somebody is evil, then you should be indifferent, you should not try to go with him. Okay, if somebody follow this, what will happen? He will have peace in mind. And I just want to remind everyone that during the COVID period, if you remember, each and everyone in the world, they have contributed to those people who have got unemployed because of this COVID. Everybody was having, people have seen that they are just serving foods to those who are needy and those who are walking a long distance, covering a long distance to return back to their home. People are having. Now, if you take a survey that what type of feeling they were feeling they were having, the feeling, what I can expect that definitely they were having peace in their mind. They were having some calmness in their mind. Now, this is the thing what Sage Patanjali has told us. Now, in the just another slope, this is also very important. Why it is important? Because it is also related with the calmness of the mind. And here, the Sage Patanjali is giving a method and a technique that what is the other method by which somebody can have this peace, peace of the mind. Okay. So whenever we're talking about the peace of the mind, or you can say clarity, that means we want to be in a prima facie, we want to be away from the stress. This is the latent point, you can say. So what he has given that prachadan vidharam bhayam va prasyam. That means what he said, that prachadan vidharam bhyam va pranasya. That means prachadan means by exhalation. Okay, this is the point what he has given. If somebody exhale out, okay, repeatedly is exhaling out, then what he is doing? Vidharabhyam, that means is controlling and controlling and retention of the breath. If somebody does this repeatedly, what will happen? Again, the mind will be calm. So in a single line, if I take the help of this Sage Patanjali sloka, I can say that by throwing out and restraining the breath, the mind, now one can get the calmness of the mind. And we all experience that whenever we are tired, what we used to do? We used to exhale out. We used to say, huh, now I'm feeling good. Now, when we are doing ha or we are exhaling out, by this, what is happening? We are controlling our stress. We are trying to calm down. Now, this is the things what the ancient literature, it has already given to us. Now, let me give you a small picture about the COVID, that what happens during the COVID time and what type of feelings the people were having. If you look at the reviews from the WHO, you can see that they have mentioned that COVID-19 disrupting the mental health services in most countries. Now, this is the report. The biggest thing what has been affected, apart from the other things, that is the mental health services. Even you can see that people were so much worry, they were having fear in the mind, they were having a stress, and even because of these all, what is happening, people were having the suicidal thoughts in their mind. They were having the severe distress. You can see here, this is one of the survey I got from the internet, and this is from one of the university of the France. Okay, so they were having severe distress around 22.4%, and high level perceived stress, severe depression, and high level of anxiety. Now, COVID period was such a time when people are having so many problems. Now, if we have to take about the management, then I have already explained in my earlier slide that long before, you can say around 2000 to 3000 years before, the Sage Patanjali has already given the technique what we can do. The best way, or best, you can say the inexpensive method that is given, that you have to exhale out. And once you exhale out, you will be, your mind will be, it will be in peace and it will be calm. Okay. So this is one of the results what we have got during the time of COVID. Now, let me show you some benefits of the researchers. You can see this is one of the visualization. And let me tell you before that, one of the limitation of this visualization is that this data has been taken from Web of Science. I could not get the access of Scopus. That's why this is based on the Web of Science data only. And what I found that when a matter of yoga comes, the country which is doing most of the researches and scientific research, that is US. You can see the graph, that is the US, they are doing most. And then the another country which is coming, that is the India, and then the Germany. And in this way, you can see here a lot of list that so many countries, they are practicing yoga. And with this visualization I have prepared with the help of the Wasvia software, taking the data from Web of Science, and you can see that what are the different areas. Okay, I am here. I'm not making any cluster. I'm just showing you that what are the different areas the people are working in relation to yoga. They are working with the depression. They are working with the stress, the mood, sleep, cancer, then heart rate variability, asthma, diabetes. Now you can see a long list is there. And even one of the most interesting what I can find is the PTSD. This is post-traumatic stress disorder. Okay, now after post-COVID, you can see still people are in fear. Still people are taking a lot of precautions. Okay, they are unable to come out over this their traumatic phase. Okay, now here what we are getting that different areas are there where the work has been already done and it is still continuing, right? Okay, let me show you another picture over here. And this data I have taken from the NCBI. And here I just want to show you the cluster, here the cluster, and in the center it is the yoke. And you can visualize it here that how the physiological parameters, mostly the people are doing with the physiological parameters. Like you can see the cholesterol, the blood glucose, and the lipoprotein. And another, you can see the lifestyle. And when you are seeing this connecting line, this is showing the strength of the strength with the parameters. Now, how this yoga is related with the lifestyle, hypertension, obesity, posture, and in the same way, the autonomic nervous system. Yes, this is very important. Autonomic nervous system, we'll discuss later on that why it is so important. And here you can understand the relationship of the guiding slope, what I have discussed earlier, and the method, what Sage Patanjali has given. Okay. Now, another thing I just want to show you all regarding the latest method what people are following nowadays, that is the online yoga therapy. Okay, this is another thing. And what I can find here from the available literatures, that it is not new, you can say, online yoga, because from 2016 I have already got that 4 studies has been already published, and that is related to the PTSD, post-traumatic stress disorder, and the myeloproliferative neoplasm patient, like cancer patient. Madam, people, the scientists and the doctors, they are all working on this. And in 17 also 4 studies I found that quality of life and irritable bowel syndrome, then the mood, the pain management, and the public health. Now I can find out that from 16 to 2020, and now again in 21, a lot of online yoga sessions are going on. It is a new paradigm which is taking place for implementation of the yoga. But what I can say that yoga should always be performed under the guidance of some experts. That is more better. But when something is not available like this, then online yoga can also be followed. Okay, so here is my the second angle what I have already discussed, that what are the researchers they have done and which are the different journals they have published. And I have taken the data from 2020 to 2021, and these are all related to COVID. Okay, each and every study I have collected, this is related to COVID. Now what I can find out here, that one of the author, he is Keswan MS, and he has published his paper in the Indian Journal of Psychiatry in 2020, and he has emphasized about the Bhagavad Gita. And he says that when Bhagavad Gita is a very good method for psychological resilience, because it helps you to come out from the things. And this what we in our Indian tradition we are already having like this. And again I found that Bhattacharya and Acharya, they have also published their paper in the Psychiatric Quarterly, and they have discussed about the mental health disorder due to COVID. Okay, they have given and they have also informed regarding the different strategies how it can come out. And each and every these studies are related with the yoga also. They have used in some part, or you can say fully, they have used the yogic method, yogic styles they have used. Either they have used the asanas, they have used the pranayam, or some yam and niyam, you can say, some form, you can say mild or moderate, everything they have taken. Now, another study, what I got that, one of the study done by Leah, Kiesper, Watt, Eonson, and Forklet, these are all the researchers. They had did their study in 2020, and they have mentioned about the SKY, that is Sudarshan Kriya, and they have implemented this online only. And what the thing they have got, that by having this breathe control, they are giving that that people can overcome from insomnia, the people can overcome from anxiety, depression, religion. So what they have already suggested us, that phase wise breath control technique, either it can be fast, medium breath followed by meditation. It is very helpful to overcome this problem. Now see, now here you can relate with the sage Patanjali's second slok, my guiding slok, that he has already said that when you are exhaling out and controlling, you are retaining that, that will help us to calm down our mind. And here see what the scientists, they are already establishing things. And again, another study I got from the PRHA from in 2020, and it is published in the journal PLOS 1, and they have recommended that in the COVID, yes, home-based activity is very good. Now here you can see that yoga is such an activity what you can do in your home also. Okay, you can feel your home place, but you know, in the literature it has been mentioned there are certain conditions where you can do, where it cannot do. But what we know that home is our best place, home is our like temple, ye mandir hai. So there we can do our activities, and that there is also we can do this yoga activities. Okay, now let me give you some another studies which are related with the COVID and the yoga. What I could find that one of the author Boston, he has published his paper in Frontiers in the Psychology, and he has mentioned about the Sim Yoga, and this is one of the technique designed by the Sadhguru to boost the immunity and to enhance the lung capacity. Okay, so what point I can give you all to my viewers, that Sim Yoga is also there, and as it is published in the journal, so definitely it will be very scientific in nature. Even there is a long list of these publications, but I will just discussing about the key points what I could figure out from different journals, that not only yoga, even your food habits, what you are taking, okay, the way you are consuming the fruits, you are consuming the vegetables, you are consuming the vitamins, these omega fatty acids, along with this. That's why, you know, even in our in a yoga literature, we are finding about the ahar, bihar. Then that means along with the activities, you have to concentrate on your food habits also. You have to consider what type of nutrients you are taking. That is also very important. So this author, the Komipur et al., they have already given that if somebody is doing aerobic or resistance training, respiratory muscle and yoga, along with the consumption of the food items, definitely their health will be good. Another study which has been very related with the COVID, that was published in the Journal of Environmental Pathology, Toxicology and Oncology, and in relation to COVID, what they have given, that if somebody is doing yoga followed by nasal breathing, in bracket you can say that it is the pranayama, followed by some herbal administration like garlic, ashwagandha, it has a potential to develop the immune system. You know, we cannot fight directly with the COVID virus. We can develop our immune system. Once the immune system is developed, definitely we can say that we will be safe. So that's why they have also mentioned this solutions they have given. Now another thing, what appreciation I can take from the authors, that is, okay, that is that they have given that yoga is such a easily available activity. It's so simple, it is so inexpensive, it is safe, and it is non-pharmacological intervention. See, this is very important. It's a non-pharmacological intervention to overcome the stress, anxiety, depression. So now here you can see again that how the slope of sage Patanjali, what he has said earlier, it is getting supported from these findings. Okay, one very interesting I got from Asia Pacific Journal of Public Health, published in 2021, about the Sudarshan Kriya. It has given from Shri Ravi Shankarji, that how this rhythmic yogic breathing is having a very beneficial effect on the anxiety and aggression. Okay, so these are all the study, and I'm having a different list of these findings, and out of this, let me take your attention to one of the another study where they have mentioned in the frontier of the psychology, that is brain wave modulation technique for stress. And again, for this brainwave modulation technique, they are using the yogic activities, right? So in this way, we can come to a conclusion. Now, we can come to a conclusion that yes, yogic activity is very much helpful, is very much, you can say, simple. It is very inexpensive, non-pharmacological for developing the human immunity, for developing, for reducing the stress, okay, for getting rid of this insomnia and other problems. So this is the list is full of each and everything. Now here I can just show you another thing, that during the COVID period, most of the people, they have followed the online yoga. Yes, these are the studies you can see here on your on the screen, that the scientists, they have used the online yoga method. Okay, and by this also they are just saying that if you are in your home, if you are away from your home, again you can follow the guidelines which have been given by the online. Again, you have to keep in mind that whatever the yogi program you are following, that must be given by some experts. Okay, so let me take your attention to one more journal, that is Journal of Alternative and Complementary Medicine. They have mentioned about some app also, that different apps are being made. Okay, and by using the different apps, the people are coming out of the this different type of mental disorders, right? So one app I got, that was published in International Journal of Environmental Research and Public Health. Okay, and the researchers are the Tumka are this team. They have made a app that is the Yoga of Immortal app. Okay, this is the name of the app, and they have found a very significant improvement from the insomnia. Yes, this is very interesting to know that. Well, these were the findings what we have already got from different journals, that what are the different things we can get the solution by performing this yoga, and especially in the period of the COVID, the time when all the world was having this lockdown period, right? Now, let me come to my the third dimension, and in my third dimension I'll be discussing about the scientific explanation, you can say some physiological explanation that will take. And in my center, as I've already told, that during the COVID period, people are having a lot of mental problems, and out of that one mental problem, you can say that was the stress. Okay, so what happens exactly in the stress? In the stress, you know, if you talk about the from nervous system point of view, and you must be knowing about the sympathetic and the parasympathetic nervous system. So we already know that whenever we are in the stress, our sympathetic nervous system increases, or in the vice versa. If I say that when sympathetic nervous system is more activated, the stress will be more, and at that time when the parasympathetic nervous system is reduced, that activation of the parasympathetic is reduced, the stress will be more. Not only this, even the allostatic load, which I will discuss later, this also increases. And again, at the neurotransmitter level, different neurotransmitters are under activity, they are being blocked. When these things are there, the people suffer from the yoga. Now, what happens when you practice yoga? Okay, what does yoga does here? Now I'll be focusing in my next slide regarding the practice of the yoga. Either you are doing asana, you are doing pranayam, or whatever the practices have been given by the our ancient rishi munis, how this is helpful for this one, and why it is so important. This is important because at every time our body needs to be in adjustment, it need to be adapted, it need to be in a state of homeostasis. Okay, so this is another point from where I'm just starting my explanation. Now, homeostasis, I need not to discuss in very detail, but I can simply say that homeostasis is the body's mechanism to return back to its normal. Okay, if we take about the temperature, we know that if the temperature falls down, what happens? Our blood vessels constricts and the body gets severed, and because of this, the body gets into this normal temperature. Similarly, when the body temperature get rises, what happens? Our blood vessel dilates. Okay, sweat comes out, and because of this, the heat is lost in the environment, and again the body comes to the normal temperature. That means at each and every point, whenever there is some change in the environment, you can say, whenever there's a stress in the body, our body needs to be in adaptive manner. It needs to be in a homeostasis, you can say. It needs to be in this normal normal functioning. Either it may be temperature, either it may be hormone level, whatever level it is. This is the homeostasis. Now, another concept just related to the previous one, homeostasis, another is the allostasis. Allostasis means it is the adaptive process of stability during the condition outside of the homeostatic range. Now, what happens if something is beyond this homeostasis? At that point, when the stresses are there, this allostasis takes place. But whenever this allostasis is taking place away from this homeostatic range, it takes a cost to the body. And what type of cost you can say? It takes the cost of pathophysiological conduction. Okay, that means up to the level of homeostasis is okay, but when it reaches more than the homeostasis, when the stress is more, it is continuing from a long time, what happens? The body takes some sort of tax, you can say, and that tax is from pathological point of view, right? So what happens with this? When there's a chronic allostatic load is increases, okay, increases day by day, then it damages our organs, it damages our function. Now, I just here wanted to show you some relations that how this homeostasis is good up to a certain point, but when the load increases, you can see the chronic repeated of the stress stimulus. When it increases gradually, this allostatic load increases. Okay, but this is not a good sign. We should always try to decrease this allostatic load. Okay, so what happens when this allostatic loads are increases? From psychiatric point of view, you can see that depression is there, anxiety is there, PTSD there, drug dependence. Yes, this is another important factor. The people, they have to depend on the drug. They try to overcome their problem with the help of the drugs. And again, from the neurological point of view, epilepsy is there, chronic pain. From cardiovascular angle, you can say the hypertension, myocardial infarctions is there. From metabolic level, diabetes, obesity, and from immune, again, infection, cancer, and asthma. That means what? That means this allostatic load should be reduced. And one of the suggestion, you can say in a very concise, you can say in the mantra form, you can say in the sutra form, what Patanjali says. Patanjali is already given. He says that if you are following the path what he has given, like we have to be merciful to those who are unhappy, and by following different breathing pattern, what you can do, you can decrease your mental stress. Okay, you can develop your peace in the mind. He has already given. Now see, the things are same, and it has been related over here. Okay, so this is one of the explanation what I have taken, and again I am taking another explanation, and this explanation is from the free radical theory of aging. And we all know that in our body, whenever we're doing any type of activity, or you can say whenever the stress is there, what happens? Our antioxidants, antioxidant increases. Okay, now what we need to do? We need not antioxidant, I'm sorry, the free radicals increases. And what is to be done? We have to consume, you can say, the antioxidant, which helps to reduce this free radical. Now we can say that if we are having a healthy lifestyle, if we are having a balanced diet, and we are managing the stress, what will happen? There will be a balance of antioxidant and free radicals. Okay, but suppose what happens if we are in a continuous state of stress? Okay, what happens? The oxidative stress, you can say that. That means the free radicals will be more, the antioxidants will be less. And because of this, again, what will the outcome? The outcome will be the cancer, it will be the diabetes, it will be heart disease and the hypertension. So you can see here that from the free radical theory of aging, we need to, you can say, increase the, we need to decrease the free radicals, and we have to increase our antioxidants, right? Again, I can say that if we consume a better food, you can say the better nutrient and balanced diet food, and we are having a balanced lifestyle, again, this will be maintained. Okay, so if I say that yoga is what? Yoga is the guideline for having a healthy lifestyle. Okay, it says about each and everything, right? From physical, from mental and social, everything has been already mentioned. It talks about the cleaning of the body, either it is inside of body or it is outside of the body. Again, the theories are explained by this free radical theory. Okay, this is just a simple atomic view that whenever what happens, we are in this state of stress, the free radicals, this is unpaired free radicals, they are increases in the outer electron. But whenever we consume these antioxidants, what happens? The antioxidant is get paired off. Okay, paired off, and because of this, what happens? It gets in a balanced nature. Now, let me give you another explanation with the help of, this is called the chromosome, and on the top of the chromosome, you know, there is the telomeres. And again, I can remind you in 2009, Blackburn and her team, they have got a Nobel Prize for this, for their findings on this chromosome. And what they have said, they have mentioned about this telomeric length. Okay, this is the telomeric length. You can see on the top, this is a telomere. And what they have said that if somebody is having, a healthy lifestyle, if somebody is having a balanced diet, and if they are managing their stress, what happens? This the telomeric length is maintained. I'm using this word, it is maintained. Because of the cell division, this telomeric length decreases. But if you follow this lifestyles, this healthy, balanced diet and management of stress, this is maintained. So here you can see that sometimes you will find that some people are so old, but because of their lifestyle, they look very young. And just the vice versa, you have seen somebody is very younger. They are not having any lifestyle, proper food, and they look so old. Now, what is this? Why the reason is that? The reason is because this telomeric length. So what here I can say that directly I cannot say that yoga is related for this. But yes, if you take in a very Latin point of view, you can say, as a construct, you can say that yoga is related with the lifestyle. And if somebody is having a better lifestyle, the telomeric length decreases, it maintains, it not decreases, it maintains. So in the single line, I can say that indirectly, I can say that if somebody is performing yoga in a better way, if they're following the guidelines of the yoga, their telomeric length will be maintained, and because of this they can live a longer life. So if you remember, our sage Patanjali says that by living a yogic life, their lifespan increases. So this can be one of the just explanation using the chromosome theory, right? Okay. Another explanation I'm taking here, from you can say from this hormonal level, and this is known as the HPA axis. This is hypothalamus, pituitary gland, and the adrenal gland, and this axis is known as the HPA. Now what happens whenever we are in the stress? Whenever we are in the stress, because of increase in sympathetic nervous system, what happens? This hypothalamus secretes the hormone. Okay, this hypothalamus secretes the corticotrophin releasing hormone, CRH, right? And because of CRH, from the pituitary gland, another hormone known as ACTH, adenocorticotrophic hormone secretions, and at last from the adrenal gland, this cortisol increases. Now because of this all, what happens? The body gets, now every time this is not bad, this, if you look at from survival point of view, this cortisol very good. But my point is that if it is extended for a long time, just remember, I'm just discussing, I'm taking your attention towards the allostatic load. If it is from a long time, what will happen? This will have a negative impact, right? So if I have to make a formula of this, I can say that if somebody is in stress, I can find out that his sympathetic nervous system must have more activated, his HPA axis has been more, and his GABA, okay, this is known as the gamma aminobutyric acid, this must have been decreases, and there is a decrease in heart rate variability. So what yoga does? Now yoga, you can see here as a formula, it increases the parasympathetic nervous system. Now I just want to take your attention to this PNS. Now what's happened? We already know that whenever we are inhaling, our sympathetic comes into action. Okay, this has been already mentioned in the scientific literature of physiology. During the time of inhalation, the sympathetic is more activated, and when we are exhaling, the parasympathetic is more activated. Now here the sage Patanjali's formula comes into being, that if you exhale out, if you hold, then what will happen? Your mind will be in the peace. Okay, you will be stress free. So what happens? For the yogic people, those who are doing yoga, the major emphasis is on the exhalation, and this is being explained from this point of parasympathetic nervous system. And let me take your attention to one of the nerve fiber that is known as the vagus nerve. Yes, for the yogis, this vagus nerve must have been very important, and even our scientists, they have already told us that if vagus nerve is more activated, the people will be more, there will be more in the peace of mind, you can say that their stress level will be decreases. Now how to activate, how to regulate this vagus nerve? This regulation of vagus nerve is done by exhalation. Yes, I'm saying it is exhalation, right? So when you exhalate, what happens? This parasympathetic nervous system, in bracket you can say the vagus nerve, is activated, right? And because of this, you can say that the stress level decreases. And not only this, when your parasympathetic nervous system is and in the major way the vagus nerve, it is more activated, your HPA axis decreases. HPA means hypothalamus pituitary and gland decreases, and because of this, another thing comes out, that is the happy hormone. And we all know about the happy hormone, that is endorphin, serotonin, oxytocin, and dopamine. This comes into active. And because of this heart rate variability increases. These all things have been already explained. I'm just making a relationship, all these three. So now here you can see that how why this breathing and especially this expiration is important. And because of this, the yogis, they give their emphasis on Kumbhak. They follow maximum on the retention of their breath, and that's why this is very important, right? Okay, so here I comes to a point where I need to tell you that what are the things that you should keep in your mind for doing this yoga, right? So suppose if somebody is doing a posture, does it mean that whenever we're doing an asana, is it a full yoga package? No, it's not a package, full package. What do we have to do? We have, while doing this asana, we have to use the mantra also. These mantras are very important. Okay, now you can say that I don't know mantra. It's okay. If you don't know the mantra, then what you can do? You can control your breathe. Okay, this breathing is important. I've already given you the evidences, right? That means how you have to inhale, how you have to exhale. These are all has been explained in our literatures, yogic literatures. Not only this, you have to follow certain mudras. This is also important. Either it can be the hand mudra. Mudra means you can say, you know, a sort of you can symbolic management of the fingers. You can say of the body. You can say of the face. Some things are there. That is the mudra. So that means you have to follow the mudra also, and you have to concentrate also. You cannot say that while you are doing the mantra, you are saying mantra, you are breathing, controlling your breath, you are using the mudra, and you are thinking somewhere else. No, you have to concentrate also. And lastly, this point is the behavior. What type of behavior you are having? Just again, I just want to remind you regarding this. The yoga Patanjali's the first sloka, what he is saying. Okay, that what type of behavior you should do with the people. Now, when all these are combined together, then only you can say that you are doing yoga. Okay, yoga is not only an asana. Okay, you can say that when you are doing asana, these all three things you have to follow. When you follow this all, then only your HPA axis, then only your vagus nerve, this all get activated and you get the best result, you can say, and that is the peace of mind, right? So let me I'm just at my last point over here. A few points are there. Now I'm just giving a package over here, and in package I'm giving some suggestions that when you have to keep in your mind the posture. Your posture is very important, and this I'm just trying to explain from spinal cord of view. Now you can see this is cervical one. Okay, cervical one. This vertebra is this, and see the cross sectional area of the cervical one. And again, I just want to show you the thoracic area. Okay, this is T10, the area you can see here, and this is the lumbar 5. It is more. Now, if you see that the cross-sectional area of lumbar 5 is more than cervical area. And why it is important? This is important because whenever you are sitting, try to sit straight. Okay. Suppose if you are bending bending forward, okay, what happened? The maximum load gets on your cervical. And this is the reason in yoga literature it has been said that Padmasana, you know, this is the best meditative posture. So here I can give a message to you all that whenever you're doing a Padmasana, try to sit straight, because the maximum load will go to this lumbar 5, and because the lumbar 5 cervical area is more, so that the load will be less. Okay. Another thing I just want to give the emphasis on mantra, because you know in and in Hindi and in Sanskrit you already know about the bisar. Okay. And what is this? Suppose if I say chhatra khaga. Now whenever I'm saying this chhatra khaga, what happened? This breath is going out. Okay, that means you are unknowingly, you can say unconsciously, by using this mantra, you are exhaling out. And we have already seen that if you exhale out, what happens? If your mind gets controlled. Okay, you have peace in your mind. And whenever you exhale out, we have from physiological angle, we have seen our parasympathetic nervous system gets more activated. Not only this, we use the anuswar, that is ma, pustakam, bhavam. In this, what's happening? You are doing the pranayam. Ma is coming out. Now, because of this, what's happened again? You can see this sympathetic, parasympathetic nerve fibers. This gets activated. So, what I can say here that using the mantra in your daily life is again very, very important. So, you can see that those people who are doing prayer, okay, and those who are using their mantras, they are having more beneficial effect on their body, right? So the third thing is that regarding the breathe, and I have already informed you that this exhalation is more important, and if you exhale out, your passive nerves get activated. So suppose if somebody is in stress, what he can do? He can exhale more and more. The ratio of exhalation will be more than the inhalation. If you exhale out, okay, what will happen? Your parasympathetic gets activated and your stress level decreases. This is the best suitable method, and this has been already informed by Sage Patanjali. Now again, the mudra, I have already told you that mudras are the such a postures will develop some brain areas, okay, and they give some sensory circuits and develop the fine motor skills. And you can take the example from those people who are using the Braille script, okay. By using their hands, they are trying to read each and everything. That means what? Their sensory, because with the help of the sensory area, their brain area is get linked and it gets improved, okay. By this they can read. So one of the mudras and the concentration, it is the mental focus, and because of all this, what happened? The chakras in the bodies, they get activated. And you can see, if I have to sum up each and everything, what I can say that if you follow the Ashtanga of Yam, Niyam, Asan, Pranayama, Pratyahar, Dharana, Dhyan, and if you see, if you linearly, if you increasing each and everything, what happens? The chakras gets activated. And when it comes at the highest level, that is the dharana, okay, when you are doing the dharana, the results is what? That is the dhyan, and because of dhyan you get in the total absorption. So what I can say that whenever somebody is doing asan, he have to follow the niyam and yam also. Or I can say that try to improve ourselves from the yam point of view, okay. I'm not explaining this part, I'm just telling you that you have to follow this yam, then you follow the niyam. Once you are good in the niyam, then go for the asan. Directly if you're going on the asan, you cannot say that you will get the benefit what Sage Patanjali has already informed us. Okay, so at the last, this is my last slide, keeping the time in point of view. I can say that yoga, first and foremost, is the practice. Everything depends on the practice, how much you practice. Now when you are practicing, it develops into priority, and when the priority is there, it becomes the habit. And once when it's a habit, it becomes the rhythm of life. So you have to remember the key point, what somebody has to keep in his mind is the practice. Practice is very important. And you can I can figure out that somebody says that I love yoga but I don't practice, okay. He knows each and everything, he knows all the benefits of the yoga, but he do not practice. But there is one who loves yoga and he practice yoga. So I can say that love yoga and practice yoga, and if you practice this, you will get all the benefit what has been already informed us by different Rishi Munis. Either it is a Gherand Rishi, or you can say Swatmaram Rishi, or you can say the Sage Patanjali. Each and everybody's focus is on the peace of mind, is on the well-being of the humanity. It is well-being on the human, for well-being of all the universe they are talking about. And this is done when we follow the path of the yoga. So thank you so much to the organizers for giving this opportunity, and I hope I have tried to cover from three-dimensional area. I have taken the support from the yogic literature, and I have given the findings. I cannot say that these are all my, you can say, hypothetical. No, each and everything is based on the scientific evidences, and with help of this I came to a conclusion that yes, yoga is very useful during the COVID period, for especially for reducing the stress if somebody follows the breathing pattern. Thank you so much for giving me this opportunity.
Thank you so much, Dube sir. The session is open to questions. If anybody wants to ask anything, you're free. Yes, sir, there is a question in the chat box.
Okay.
After PM Modi declared June 21st as International Yoga Day, yoga became very important. After that, everyone recognized its importance in the COVID-19 pandemic. However, many mistakes have been made to avoid the corona burden due to yoga and pranayam. The hint you give to these consequences.
So I cannot figure out that what question is asking, but I can say that, we should be thankful to our Honorable Prime Minister that yes, he has initiated this the day we are celebrating yoga. And if you remember, before 2014, yes, we all know that the benefits of yoga, but yes, after 2014, you can see that people are trying to adapt yoga in their life, okay. They're trying to teach yoga to their kids, they're trying to implement in their day-to-day lifestyle. So this is very important. So we should be thankful to our Honorable Prime Minister that he has He has initiated this program for development of the yoga and for making this yoga in our life.
Thank you, sir. Any more questions, participants? I think it was so well researched and so well presented, sir, that all the participants are they are satisfied with whatever you have presented. So there are no questions as of now. If there are, we'll take it up later on.
Sure.
I call upon the chairperson of this session, Dr. Gauri Chakraborty, Madam, the Associate Professor from IGI PESS, New Delhi, to say a few words. Ma'am, you'll have to unmute yourself.
Am I audible?
Yes, ma'am.
Oh, thank you very much. I will not say a few words. I will say so many words for Binayak Kumar Dube. First of all, I congratulate to the organizers of this e-conference, and to you also, Binayak Kumar Dube ji, for selecting this role of yogic science in fitness management during 19 pandemic COVID. And you have mentioned beautifully, and you have covered 3 dimensions. And I would like to tell you that I am a happy person. I am a very happy person. I am a good person, because from childhood, I am doing practice of yoga. And now at my home, my daughters, they all are also performing yoga, and they have feel remarkable change in their lifestyle, in their behavior also. And whenever I travel in India also or outside also, I make friends very easily, because my behavior type, or you can say people type, is happy and good. So you have mentioned very beautifully, people are facing different types of diseases like stress, or it is a common disease, irritable bowel syndrome, and depression also. Yes, online yogic classes are going on, and people are taking help of this. And Bhagavad Gita, I think it's not our religious book. You have mentioned very beautifully. It is a way of life. It is a way of life. From morning to till in the night, if we will follow Bhagavad Gita's rules and other things, we will have a remarkable change in our lifestyles. Yes, you have mentioned a list of studied in this research work. You have mentioned the Ahar Vihar. Yes, if we will follow all these things, Ahar Vihar, yes, getting up early in the morning and going to bed early, and it will gives you a very, very good results. And also what we think also, kya vichar karna hai. And you have mentioned in one study, the herbal use of herbal and yoga plus pranayam. That was a very beautiful. You have mentioned. Of course, there's no expense of asanas or pranayam, but the results of all these things are very, very expensive. You know, it is bigger than wealth, gold, money. And yes, if we will do our any kind of pranayam or exercise under expert coach. You have mentioned Yoga of Immortal app. After this conference, I will talk to you, and I'll talk about on this Yoga of Immortal app also. And you have mentioned beautifully homeostasis and allostasis, and there was a free radicals theory of aging. And listening you know, listening you, it was a very, very expensive thing after listening your thoughts. And of course, we are running a very, you know, hectic lifestyle. All we are, those are participating in this conference or working in they are doing their jobs. We have to balance our diet, healthy lifestyle also. And again, I am emphasizing that yoga is not a exercise or a pranayam. It is again lifestyle. While we are eating, or we are doing our work, or we are doing our job, so we have to follow. Like I am as a chairperson. While you mentioned that we have to you know, consciously right posture, we have to follow a right posture. So immediately I sit like this. I will not bend my, spine. So as you mentioned, and immediately I took a right posture. Yes, you have mentioned that I am, no woman is, telling her age, but I'm telling I'm 56, but I look 46 due to, because I'm practicing yoga. Not daily, honestly, not daily I'm doing, but in a week, thrice or 4 times I'll do some yoga asanas and pranayam and breathing exercise also. Yes, you have mentioned very beautifully 5 things like mantras and mudras and chakras and swash and behavior, and it will definitely activate the vagus nerve, which gives us very peace. And Padmasana, you have mentioned about, you are talking about Sanskrit language. When we speak Sanskritam, Pustakam, it automatically, chant some kind of mantras. So I'll not take much of time. I again congratulating the organizers and all the participants, all the resource persons. And in the end of this, my talk, I say, Binayak Kumar Dube ji, it was a Gagar mein Sagar. Gagar mein Sagar. You have given so much information. Thank you very much.
Thank you, ma'am. I call upon Dr. Vijay Datarkar sir to say a few words in the end.
Thank you, Dube sir. Thank you, Gauri ma'am. आपका जो टेक्निकल सेशन में आपने बहुत इंफॉर्मेटिव आज योगा के बारे में इंफॉर्मेटिव हमसे शेयर किया आपकी चीज़ें. तो मैं फिर से एक बार सभी ऑर्गेनाइजिंग सेक्रेटरी डॉक्टर तपन दत्ता सर, संजय चौधरी सर, डॉक्टर माधवी मैडम, इन सब का अभिनंदन करता हूं कि आपने एक अच्छा टॉपिक लेकर से वेबिनार ऑर्गेनाइज किया. वंस अगेन कॉन्ग्रेचुलेशन सर. थैंक यू मैम.
Dube sir, there is a question in the chat box. Can we take this up? One question only.
Of course.
Yes. The question is to Dr. Dube. Sir, can BP and sugar patients leave taking the tablets by practicing yoga? Dr. PG Gavande is asking this question.
Okay, thank you so much, sir, for posting this question. But I can say this is beyond my expertise because I'm not a doctor that I can tell you that you should not take medicines. But what I can say that, yes, if you practice this yoga, definitely the number of the medicine will decrease gradually. Okay. So this, I think the doctor is the best person to give you this answer, right? But I can say that, yes, prevention is better than the cure. So if you do yoga, what will happen? The things will be more prevented, right? This is my answer. Thank you.
Thank you so much, Dr. Dube, Dr. Chakraborty. With this, we come to the end of the 6th technical session and we move on to the 7th technical session. For this, may I call upon Dr. Romi Bish Madam to chair the paper presentation session.
Hello, am I audible, ma'am?
Yes, ma'am.
Okay, thank you.
Let me take this opportunity to introduce Dr. Romi Bish, ma'am. Yes. Dr. Romi Bish is the Director of Physical Education, J.M. Patel Arts, Commerce and Science College, Bhandara. She has done her Bachelor of Physical Education and Masters of Physical Education from Ishwar Deshmukh College and has completed a PhD in 2019 from Nagpur University. She has qualified NET examination and SET examination, and her field of specialization is handball, athletics, sports psychology, sports biomechanics, and sports training. We have a versatile person with us as the chairperson. I request Dr. Romi Bish Madam to take this further.
Thank you so much, ma'am. A very good afternoon to one and all present online here. First of all, my heartfelt thanks to all the organizing colleges, Nagpur Sharirik Shikshan Mahavidyalaya, Shri Binzani City College, Nagpur, and Institute of Science, Nagpur, for giving me the opportunity to act as a chairperson in this third international e-conference on role of sports psychology and fitness management for sportsmen during COVID-19 pandemic era. Before starting this session, I would call the names of participants and request them to be ready as per their sequence with their presentations.
Bish Madam, I am going to make you the host for now. After we finish the session, you can again make us the host so that you can unmute people.
Okay, sure, ma'am. Thank you.
Yes, ma'am. You can make them the co-host, those who are going to present the papers, so that they'll be able to unmute themselves.
Okay. Now, the first presenter is Shrikant sir from Lakshmibai National Institute of Physical Education, Gwalior. His topic for presentation is Association of Overweight Obese with Flat Foot among the School Children. Shrikant sir, are you present?
Yes, he is there. We'll have to make him the co-host, ma'am. Otherwise, he won't be able to unmute himself.
Okay.
Please search in the participants list, his name.
Yes, ma'am. Shrikant sir is there in the group.
Thank you, ma'am.
So please unmute yourself.
Shrikant sir, your voice is not audible.
Yes, thank you, ma'am. This is Shrikant from Lakshman Institute of Physical Education. First of all, I'm thanking to all for all delegates for opportunity me to present myself in this conference, especially for Dr. Datta. Now I'm proceeding towards my presentation. Now, can you make me a host to I share my presentation?
Yes.
Thank you, ma'am.
You can share now, sir.
Yeah. my co-author is Dr. Pushpin Purushwani, is associate professor in LNIP. Now I proceed. My topic is association of overweight, obese with flat foot among the school children. Before proceeding towards the main part, we discuss about what is the flat foot and overweight and obese. Flat foot is a condition where one or both feet have little to no arc. It is a arc of the arc of the feet should be disturbed or a collapse due to the some reason of, that we discuss later. Uh, Next one is overweight or obese, or we can also call the obese as a obesity, defined as abnormal or excessive fat accumulation that may impair health. It is a harmful for a health for the children, for a children and also for adults or youngers. Uh, the purpose of the study, this investigation was the association of overweight, obese with flat foot among the school children in the urban area districts of the Datia. The methodological I have used in this investigation, this is a survey study in which I selected 1230 school children. After the normalization technique, I got 1145 school children. and the age of the children is 8 to 12 years. The equipment I used in this study a BMI index according to WHO guidelines, and for assessing a flat foot I use a Clark index. I for a statistical technique I use a SPSS version 20 packages at the significance level of 0.05 that I already discussed. This is a result that I saw, that you saw on the screen on urban area on overweight. Next one is a pi-square test statics. That is I get a significant with flat foot. Next one is obese and flat foot descriptive. That is a chi-square test, obese and flat foot. That we talked about the result. The prevalence of overweight with the flat foot in school children of urban area of the district. The flat foot with overweight with flat foot 24.7% in the urban area districts of the India. The association of overweight with flat foot is significant at a 0.00.3%. The prevalence of obese with flat foot 29.6% in the Tia district at a significant level that we get in 0.01%. We now discuss about the uh, on the conclusion part or discussion part. This study confirms the significant association between the overweight and flat foot that we already seen in the result part, and also confirm the significant association with obese and flat foot and overweight. The incidence of flat foot deformity in school children of urban area because of the overweight or obese, or we can say obesity, is one of the significant reasons. Apart from this, there are some other reasons also, like children carry a heavy bag in school, a shortcoming of muscles due to the weak muscles, a key float stance, a wrong stance that we use in a what we say sitting or in a walking during the walking, inappropriate bearing, standing that we inappropriate bearing, some other psychological factor that impact on our body posture, on our mind, that we carry the obesity or obese or a flat foot postural deformity. Therefore, there is a several need to constituting many similar kinds of other research studies as considering different age group for reason and deformities. This study is also helpful for the school teachers or physical educationists. Go for through this study, they help to improve the child's health. They are reduced to help to overweight or obesity in children, and also improve the posture of the children. This is my study, and thank you for all. Thank you for the attention. Thank you all.
Thank you, sir.
Thank you, ma'am.
If from any other question from audience, you can ask or write in chat box also. Okay. Shrikant sir, your
Yes, ma'am.
presentation is very nice. And I think this type of study is in need of an hour now due
Yes,
to
ma'am.
this online and modernization.
Yes, ma'am.
So I have one question.
Yes, ma'am.
What are the difficulties would you face to encounter during your research study?
Ma'am, basically, I face a difficulty toward the schools. They denied for the collection of data, and also for parents' permission. They said first go for a parents and ask permission for collecting a data on a children. But they also denied for, because they are the school. They have said our schools what we can say schools get a bad impact on this study because they don't do their physical activity or such other things. But I consulting them, I make them agree for this study, and also go for with their parents and agree them to they are helpful their children, not only their children, for all the children or the city or a state, or and also India, for also country. If they are initiative they contact, they will get a very good result.
Okay. Okay. And which sampling method you use to select the samples?
In this way, I use a multiple stage sampling method because there is a school children, different types of school children and different levels. Basically, this is my PhD part. This is my PhD research topic. One of the simple topic that I get from my PhD. That's I use a multiple stage sampling method in which a different basically in PhD I get a 5 districts for Chambal region. Districts are Gwalior, Sipuri, Datia, Ashoknagar, Guna. From which this one of the district is Datia.
Okay, okay. Thank you. Thank you for your presentation.
Thank you.
Okay. The next participant is Dr. Sunil Bhotmange sir from Kayawade College, Koradi. His topic for presentation is health management in COVID-19. Dr. Sunil sir. Sunil sir, are you present?
सुनील सर अपने आप को अनम्यूट कीजिए प्लीज।
प्रेजेंट है वो।
हाँ मैं।
Right. Thank you, sir.
Okay.
Uh,
Good afternoon, ma'am.
Good afternoon.
And first of all, I'm very much thankful to Datta sir, Chaudhary sir, Madhvi ma'am, for giving me opportunity to present my paper. My topic is health management in COVID-19. The COVID-19 infection disease has directly and indirectly affected the lives of many people. This infection disease has created havoc in the lives of people in India and had affected the lives of thousands of people in many ways. In such a situation, Yoga Shastra proved to be the basis of life. Yoga has a glorious history spanning thousands of years, Vedas, unsplits. Yoga is for everyone. It is the caste, creed, belief, tradition, norms, custom, country, wealth, power, philosophy, poverty, wealth. None of these things interfere with yoga. This practice is to be done simultaneously, voluntarily, and the practice of yoga says that only asana, Surya Namaskar, pranayam come before our eyes, but the scope of yoga practice is used. This includes prayer, supplementary exercise, asana, pranayam, mudra, bandha, purification, yoga diet, etc. Cleaning the body is the first requirement of yoga practice. Yoga is about giving rhythm to life. Yoga is about understanding and harmonizing the different aspects within you. This beneficial life skill increase the standard of living of a person and the environment around him. It helps us to improve our inner strength and our outer feeling. Yoga brings complete balance in the personality of the seeker. Your outward behavior and attitude start improving. According to today's practice, all that is meant to be satisfied is sure to come through yoga. Those who hope for the ultimate truth in which the talent consciousness is fully awake by the path of yoga to achieve the highest goal of oneness with that infinity principle through yoga. There are 5 types of yoga mentioned in the Indian Yoga Shastra: Gyan Yoga, Hat Yoga, Om Karma Yoga, Om Bhakti Yoga, and Raj Yoga. The Yoga Sutras. The Yoga Sutra are not a detailed discourse. The entire philosophy of yoga is given very briefly in a few verses, which need to be explained under the guidance of a guru. They come in hand as a guide as the seeker descends to a deeper level of consciousness through practice. However, because of yoga, we experience unimaginable changes even at the gross level. Importance of yoga science in lockdown. The epidemic made people captive during the period of lockdown. In such a situation, medical use of Yoga Shastra for health management has proved to be a boon for the people even while staying at home. Nowadays, yoga is also being resorted to be for the good health. But what is health and how is yoga used for good health? Good health is a balance of mental, physical, intellectual, and spiritual. The science of yoga includes three things: mental, physical, and spiritual. These three important things maintain the balance of human life. Yoga is not only a preventive science, but also a way to prevent disease. People believe that yoga practice was an ancient method of spiritual enlightenment. But in recent times, yoga has become a part of lifestyle of people from many cultures and backgrounds. But now it is also reached the political sphere around the world. It takes a lot of skill to run the technique smoothly, and doing yoga bring skill in our work. In fact, it is called Raj Yoga because in ancient times, kings and princes were doing yoga. Yoga is a great form of exercise for the body. Yoga helps in weight loss as well as in many diseases. Yoga is becoming very popular in Western countries as people get relief from stress, anxiety, and fatigue due to the occupational stress, addiction, and insomnia. Since yoga has a healing element, many diseases are reduced by doing yoga. Yoga also introduces and develops the talent, potentiality within. Yoga has a profound effect of many level of our existence. At the last conclusion, the lockdown of this corona period put a lot of pressure on many people. Many people started going into depression. For such people, yoga started working as nectar. There is a power in yoga form which keeps people calm and energetic, both mentally and physically. People understood this power and yoga became an integral part of their life. Gym have reopened after lockdown, but these are many people who think that doing yoga at home is more beneficial. It can be said that this coronavirus has made people understand the need of yoga in life. The Sanskrit proof Sharyalya Madhyanam Kalu Sada mantra is very important. If there is a good work to be done, it is difficult to get the result of that work satisfactory without a healthy body and mind. Apart from strengthening our immune system, yoga helps us stay physically fit and emotionally stable. With regular practice of yoga, your energy is always at a high level, which increases your enthusiasm. You are more expressive through your vibration, and with yoga, your vibration becomes positive and attractive. Yoga is a discipline that opens the way to inner liberation. From this, it is clear that this fearful situation of Corona, Yoga Shastra has proved to be a boon. Thank you very much, madam.
Thank you so much, sir, for your presentation. And yes,
Thanks a
definitely,
lot, ma'am.
yoga is very important in our today's COVID-19 pandemic situation. Sir, I have one question. You do review study before this survey. So how review of
Yes,
literature
ma'am.
to do this survey study?
I have for the survey study, ma'am, I have to go through some at the practice in the evening and the ground in the morning. So I approach the students, and I have gone to the in the college also. So I had discussed the matter with the lecturers and students also. Like that, I had covered this topic.
Okay. Okay, thank you. Thank you so much.
Thanks a lot, ma'am. Thanks a lot, ma'am.
Romi
now-
madam, Romi
Yes.
madam, there is a, I'm disturbing you. There is an
No, sir.
announcement
Yes.
that every candidate is allowed to speak on his topic for 5 minutes, and 2 minutes or 1 minute will be given for the discussion.
Okay. Okay, sir. The next participant is Dr. Praveen Kumar from NMD College, Gondia. His topic for presentation is a comparative study of body composition of football players, Gondia. Praveen, sir.
Maybe he is not present in the group, ma'am.
Okay. After that, the next presenter is Sunil Sangade from Sangamnir. And his topic for presentation is position for 7 players in handball team. Sunil Sangade, sir, are you present?
Madam, next.
I think. Okay. The next presenter is Miss Praveena A from Karnataka. And his topic for presentation is uniqueness and effectiveness of riding bicycle in managing physical fitness of secondary school students during COVID-19 pandemic. Praveena madam, are you present? Praveena,
Ravina is there.
yes, yes.
Sir, sir, please unmute your mic and start.
Yes,
with-
Okay, sir. Welcome to Romi Besant ma'am, research chairperson and research person and all participation. So myself Praveen A, research scholar, Department of PG Studies and Research in Physical Education, Kuvempu University, Shankarkatta, Karnataka. So my topic is uniqueness and effectiveness of riding bicycle in managing physical fitness of secondary school students during COVID-19 pandemic. So introduction. Health and physical fitness fitness are most important in everyone's life. Good health and physical fitness to interrelated realities for leading a happy life with complete physical, mental and social well-being. Physical activities are very important to have physical fitness and health. Regularly, physical activity protect everyone from seriously diseases and health issues, but COVID-19 has isolated everyone through social distance, where cycling can be the best exercise to maintain physical fitness. It is commonly considered that the act of cycling is one of the best way to physical fitness and desirable health by reducing a number of risk health problems associated with a sedentary lifestyle. Cycling is a healthy, low-impact exercise that is suited to any persons from younger children to older adults. Lack of physical activity and its consequences among adolescents, teenagers who aren't physically activity may experience the negative consequences of this. The physical activity, which can be long-lasting in its survives from pandemic situation, contribute to the negative impact of the health of adolescents. Suitable exercise in the pandemic situation, strengthening one's immune system, part of daily exercise keeps us social distance, best for self-protection, cycling best for happy and entertainment time span. Health benefits of cycling for the adolescents during pandemic. Individuals who cycling regularly have also reported mental health improvements, including less perceived stress and better vitality. So obesity is one of the major health issues seen among adolescent students. British researchers show that a half hour daily and they will burn nearly 5 kilometers of fat over a year. Hence, cycling can be best side utilized and the mean of finding solution for these problems. It is very helpful to younger ones who suffer the heart related problems. Regularly cycling stimulates and improves heart, lungs, and circulation, reducing risk of cardiovascular disease. Cycling strengthens heart muscular, lower resisting pulse, and reduce blood fat levels. So, rotational behind the appropriateness of cycling in the lives of adolescents, since it is proven that exercise makes one healthier and happier. Cycling can be considered as one of the physical activity that it the perfect outlet to the teenagers with individual space. For a psychological perspective, it increases self-confidence level, it increases self-motivational, decrease stress levels, improve postures and reduce anxiety and depression. So B is from mental development perspectives, improves their mood, reduce their stress levels, reduce in them depression and anxiety symptoms, boost their self-esteem, enhance their body image. For social perspectives, development of a health social
Sorry,
circle.
Pravina, sir.
Yes,
Sir,
yes,
you
ma'am.
please go through the methodology and result part.
Madam, that is thematical paper, ma'am, not a methodology.
Okay, you can
I can-
conclude your paper within 1 or 2 minutes.
Okay, madam. So this conclusion, this education system has given less importance to physical activities during school hours by starting that it will never contribute to the actualization of life dreams. To for teens, being physical activity is more challenging than others to incorporate needed physically activity into their hectic schedule of this study life. Adolescents suffers a lot of manage their hormone imbalance by being in the walls of their home, since physical activity for health is more important for teenagers in their more stressed and more tight study scheduled during the teenagers years. Cycling can be realized and as the best exercise in many aspects. Physical activity and higher levels of fitness are linked to the improving cognitive performance in areas such as memory and concentration. But being physically activity through cycling team can be improved their health and memory, their concentration, and their ability during the pandemic. These are the references of the studies. Thank you. Ma'am,
Okay, thank you, sir.
I'm audible.
Yes, yes. Thank you, sir, for your presentation.
Thank you.
Sir, I have one question.
Yes, ma'am.
What motivated and inspired you to carry out this?
Voice is not clear, ma'am.
Excuse me, sir. Excuse me. Wait. Sunil, sir. Sunil, sir.
Yes, sir.
Mute yourself, sir.
हाँ sir.
Please, sir. Yes. Carry on, sir. Carry on. Pravina, sir.
Yes, sir. Yes, ma'am. Please
How
repeat
did you
once again.
motivate to select this topic?
Madam, this is my research related topic, ma'am. This so present situation, how to face a pandemic situation for school students, ma'am. So because of the during the COVID pandemic.
Sir, I have a question. So what was your topic?
So uniqueness and effectiveness of riding bicycle in managing physical fitness of secondary school student during COVID-19 pandemic.
Sir, I think so. This the topic you have selected, right?
Okay, sir.
Is an experimental. It
Yes, sir.
depicts
This
is
is
an experimental study. But
Study,
you
yes, sir.
said, but in your presentation, you said that it is a thematic topic. How
Oh,
it can
yes,
be
sir.
thematic topic? And second question is,
Ah.
when you have taken this study in a pandemic era, there was a
Yes, sir.
complete lockdown in the state of Karnataka. So
Yes,
at
sir.
what time you have conducted this study?
Sir, present time is school is opening, sir. I collect my data, sir. Present time during the
So what was the duration of it?
sir. Sir,
So
voice
what
is
was
not
the
clear, sir.
duration of your study?
So duration of hello,
Hello.
I'm audible, sir.
Yes, yes.
Sir, during during sir, my already 2 year research work, sir, but because of school is closed because of the lockdown, sir. So, but present school is there are schools, so many schools as opens government schools, such. But I collect my data, so please these year.
There is one question in chat box
Yes,
from Umesh Uthasani.
yes,
I
sir.
have a question. What will be pace of cycling to get this benefits?
Yes.
You got it? So what should be the pace of cycling so that the person who are practicing cycling can get these?
So many benefits are there, sir. Muscular strength and cardiovascular endurance. So many health benefits are there, sir. So basically for high school children, so many health. So many students are suffering from health issues. So, but government issues the bicycle scheme. So this is the best. So health so long during the distance covering.
Okay, Romi madam.
Yes, sir. Okay, thank you, sir. Thank you, Datta sir. Now the next presenter is Sunil Sangle sir from Sangamner. Sunil sir, are you there? Sunil sir?
Yes, yes, madam. Hello.
Yes, sir. You can start your presentation, sir. And the time
Good
limit is
afternoon,
5
everybody.
minutes.
My topic name is position for the seventh player in handball. Sunil Ambarnath Sangle, research scholar, Nanded University. Abstract. The purpose of the study is the introduce the handball player position and how they play. There are the 7 players at a time of playing in the court. They have chest number on his jersey by their the playing the position interrogate. Also study details information on rules of playing of each player. It is the found that the contribution of everyone in the handball team is important and the players' position are the selected according to their individual skill and the track records. The keywords handball playing position 7 players. Introduction. A full squad in the handball teams are considered of the 16 players, but only 7 play on the court, each with the differing role and the positional responsibility. What are the 7 positions in the handball? This is research paper explain how player the position number related to the formation and the code marking. There can be not more than the 7 handball position participating in the game at any time. There should be always on the goalkeeper and the remaining 6 out court players. Two backs, full backs, left and right, and the center back out player, 2 wingers, left and right, and a circle runner. Call it Poyot, make outfield team. The jersey numbers. The jersey numbers, the most players will have a number on the back of their handball t-shirt. Thus, the primary purpose of the position numbers is for the positional identification. The handball equipment list allow to each the player to choose their shirts number at the start of the season. However, the team numbers do not correspond to any particular position in the handball for the modern game. Goalkeeper number one. Goalkeeper goalies is the playing player with the responsibility of the defending the goal. He or she can do it using the almost any part of their body. Goalkeeper are the only member in the team who can touch the ball legally with their feet. A good handball goalkeeper will stop or deflect deflect the shot fired at them by the oppositions in the shot, and the goalies need to have the quick reaction. Then left and right back. The left and right back court player form a large part of the back line. They should usually be responsible to the left and the right of the center back. As a rule, both back court members will have a gather in proceeding, but and the will often to the largest player on the team together with the center. They all form the wall of the defensive power and the accuracy. Their main role in the trying to prevent the opportunity for the shooting and the scoring, and when defending the try to block shot and the cover the circle runner. But these handball player position PP operating big free scoring long large shorter when the team is in the attacking mode. Back left and right or right players are the always taller, having the gather hand grip strength and the superior aerobics capacity. Handball position center number 4, often referred to as the center back or the center half, is the player primary occupies the middle of the court. The center spearhead the attacking and the shoot or the there to protect defense. The players in this handball position is also called the team point guard. According to common handball terminology, the player would also handle any blocking role. Left and right wing, the players occupying the left wing would usually be right-handed. They cover the left-hand side of the court, wherever the right wing player will be actually be a left-hand player. Their role is the covering the right-hand side of the space. This handball pivoting player number 5. The role of the pivoting player in the handball is that of the attacking player. The pivoting player is also called the line player. This handball position play most of the game along the 6-meter line at the opposition baseline. This circle runner or pivot from the close the partnership with the center back. They both try to expose the gaps and the weakness in the defense of the opposite number 5. Handball is also required to shoot, and the offense have to substitute player. It is required to check the competence in handball rules and the regulation for the further information on player substitution. They can occur at any time during the game and without limits or the stoppage and time as generate rules. Each them can have to 7 substitutes waiting for on side ready oxygen. Handball, the second most popular team sports in the Europe after the football, and the exciting, fast-paced and high-scoring game. The game is the unique with a rapid and the physically yet semi skillful and the strategic style of play. With the
Sunil sir, sorry to interrupt you. You go to the conclusion part, please, because your time limit is extended.
Okay. Thank you. Okay, thank you, madam.
Okay, thank you, sir. Study is about the position for 7 players in handball team.
बोलिए madam.
Hello.
Yes, ma'am. Yes, बोलिए madam.
सर इसमें जो आपका फोन इको हो रहा है तो आप थोड़ा दो फोन एक साथ मत रखिए.
हेलो.
हेलो.
हाँ बोलिए मैडम.
What is the role of pivot player in handball game?
Yes. Sorry.
There is a player called pivot player in handball game. What is the role of pivot player?
Pivot player. Pivot player.
Pivot player.
Yes, madam. Pivot player.
Yes,
pivot player.
हाँ pivot player. PP.
Yes. तो उसका क्या रोल
पीपी
होता है?
मैडम, पीपी का रोल होता है मैडम, जब सामने से अपनी टीम अटैक कर रही होती है तो जो सेंटर बैक और राइट इन और लेफ्ट इन इनको जगह बनाने देने के लिए, जिनका गोल एक्शन क्लियर हो और गोल काउंट हो जाए, इसलिए उनको जगह बना के देने के लिए पीपी का हैंडबॉल में यूज होता है. जैसे कोई अटैक कर रहा है और कोई मूव बना रहा है तो मूव बनाने के लिए पीपी प्लेयर सामने वाले डिफेंडर को स्क्रीन लगा के अपने प्लेयर को जगह बना के देता है.
Okay, thank you sir.
Okay, thank you madam.
Okay, the next presenter is Aruma Jana. Jana ma'am, are you present? Aruma Jana madam, are you present?
Arumai Jana. Maybe he is not present, ma'am. Now.
Not present. I can't see his name. Okay, the next presenter is Neha Baghel. Neha madam, are you okay?
Yes, she is in group, ma'am.
Yes. You are co-host now, ma'am?
Yeah.
You can start your presentation.
Hello everyone, and very thank you to the organizing team for giving me this opportunity to share my research work with all of you. I am Neha Baghel, and a PhD scholar from the Department of Physical Education and Sports Science, University of Delhi. So today's my topic is a comparative study on gender difference in cyclists on the basis of selected psychophysiological variables. So very first, I would like to share my introduction. Road cycling is a very popular event and it's growing nowadays in the country. There are a few different type of events like velodrome, road cycling, mountain biking, and much more. And in road cycling, which is the topic, there are few events like mass start, individual time trial, and other team events. So cycling is an aggressive event, and it needs very hard training, strength, endurance, speed, mental toughness, and goal achieving and confidence. The male and female both are having their separate events, and females cyclists also train very hard as the males for the competition, and both the gender follow the best nutrition and training. As due to some physiological differences, male and female athletes must have some specified qualities different, but the same training and the same goal to achieve maybe affect the gender difference. Here in this study, I move further for the methodology. Yeah. So in this study, I took total 20 subjects, 12 males and 8 females. All were taken from the Senior National Road Cycling in Mumbai 2021. Their age ranging from 18 to 30 years. I selected the few selected psychological parameters, their name, achievement motivation, goal setting, anxiety control, maintaining confidence, concentration, mental rehearsal, mastery approach goal items, mastery avoidance goal item, performance approach goal item, performance avoidance goal items, and the physiological variables BMI, fat percent, and oxygen saturation. The data was assessed through the psychological skill inventory by the Whalton in 1998 and the achievement goal questionnaire for sports, which is by the Elliott and the McGeorge in 2001. And the equipment for the physiological parameters, I took the Omron body composition monitor for the BMI and fat percentage, and the pulse oximeter for the oxygen saturation. The data collected was analyzed by computing the descriptive statistics and independent t-test to find out the standard deviation and mean among the male and female cyclists. For testing the hypothesis, the degree of significance was set at 0.05. Statistical analysis was conducted by the SPSS version 20. So this is my descriptive table 1, in which you can see all the psychological parameters, all 10 psychological parameters are there of the two groups, male and females. In all the variables, you can see there is not much standard deviation among the groups, except in the maintaining confidence, in which you can see the 5.51 and 8.08 for the females. And this is the graphical representation of the mean and the standard deviation of the psychological variable male and female cyclist. Coming to the second table number 2, the descriptive statistics for the physiological variable of the male and female cyclist. We have 3 subjects, 3 variables: body mass index, fat percentage, oxygen saturation. The groups are male and female. So in this group, you can see there is not much standard deviation among both the groups. And this is the graphical representation of this variable, these variables, in which you can see the blue bar for the mean male cyclist, red one for the standard deviation of male cyclist, and green for the mean female cyclist, and one is missing due to some technical error, I think. That is purple color is for the standard deviation of female cyclist. So coming to the t-test statistics I used, here you can see all these 10 psychological variables, and here is the values are significant values there, p values there, and degree of freedom. In all the variables, all the 10 variables, you can see there is no variable having the significant value less than 0.05, but only the maintaining confidence having some closer to the 0.05, but not exactly the lower that. And this is the physiological variables, in which also you can see none of the value having a less than 0.05, only the body mass index is closer, slightly closer to the 0.05 value. As a result, the finding states that the value of T statistics is insignificant in all the variables. Because P value is greater than 0.05, all the psychological variables, achievement motivation, goal setting, anxiety control, maintaining confidence, concentration, mental rehearsal, mastery approach goal item, mastery avoidance goal item, performance approach goal item, performance avoidance goal item, physiological variables having the BMI, fat percent, and oxygen saturation. Thus, the null hypothesis of equality of variance may be accepted in all the variables. It is concluded that the variance of the male cycling players and female cycling players have an equal in these selected variables. This is maybe because of the nature of the sports or the training. I have some authors, some studies, not exactly the same, but some cycling studies I took. One study is from the FM Emphaliziri. He worked on level ground and uphill cycling ability in elite female mountain bikers and road cyclists. In their study, they conclude that the anthropometric characteristics are similar in the road cyclists and the mountain climbers. And meanwhile, the physiological profile was not different in the cyclists and the climbers. Climbers means the mountain bikers. This suggests that as the professional cyclists or the top level time trialists have an overall performance advantage over all type of trains. Hence, it is clear to state that there is no significant difference between the male cyclist and the female cyclist in these selected psychological and physiological variables. The females are having same physiological status as the male in cycling, having these BMI, fat percent, and oxygen saturation. It is also not significant, having a significant difference. At last, this is my references. And thank you so much.
Thank you, ma'am. Neha ma'am, it was very nice study and very nice presentation. For collecting, I have one question. For collecting data in questionnaire, from where do you collect data? Means which questionnaire you used to select?
I select, ma'am, two questionnaires. One, the psychological skill inventory, and second one is the goal approaching.
Okay.
I took the data from the Mumbai Senior National Cycling Tournament, which was organized on the 2021 on the March. Yeah.
Okay, okay. And for physiological differences, your hypothesis is a null hypothesis. You take your null hypothesis and it is accepted, no?
Yeah.
Okay, but male and female have physiological difference. So what is your opinion that it is accepted? Means there is some difference before starting, before taking your hypothesis, when you take this study start, then it is definitely that male and female have, there is a physiological difference, but you take null hypothesis.
Yes.
Okay. So why there is no difference in male and female in physiological variables?
There is my reason, according to me, because I took only 20 subjects, and maybe because of the less number of subjects, and maybe because of these selected variables, they did not have any differences like BMI. So this is an endurance or a speed game. So it may be because of the hard training or the nutrition, same kind of training, same kind of the nutrition, the BMI may be same. And the second one is the oxygen saturation, which is very common in every athlete, that it is around 98 to 99 or the 100. So this is also supported because every athlete have this oxygen saturation. And the next one is fat percentage. So this should be there, but I think because of the less number of subjects, the significant difference does not arise.
Okay. Okay. Thank you. Thank you, Neha ma'am. The next presenter is Balwant Salunke. Balwant Salunki sir, are you present?
Yes, ma'am. He is in group. Balwant sir,
Balwant,
please
you are not
Yes, sir.
present.
unmute yourself.
Okay.
The next participant is Balwant Salunki sir, and his topic for presentation is comparative study of psychological factor between sportsmen and non-sportsmen of Madhya Pradesh. Balwant sir, you can start your
Okay.
presentation.
Good morning, good afternoon, all of you. उपस्थित सभी सम्मानित शिक्षाविद और हमारे चेयरपर्सन डॉक्टर रोमी विस्ट, मेरा प्रणाम स्वीकार करें. फर्स्ट ऑफ थैंक्स टू नागपुर शिक्षा शारीरिक संस्थान and my respected guide, Dr. Shamsher Singh, to give my opportunity for this paper. Myself, Balwant Salunke, research scholar, Nagpur, Mansoor University, Indore. My topic is first my screen share. My paper topic is a comparative study of psychological factor between sportsmen and non-sportsmen of Madhya Pradesh. The objective of my study, the purpose of the study was to compare sportsmen and non-sportsmen on their level of psychological factor, social adjustment. Social adjustment is a term of personality, is a term community used by concerned with almost every aspect of human interaction. Just like social adjustment in the ground, in the society, in the social rules. Just like अगर स्पोर्ट्स पर्सन ग्राउंड में अपने कोच के साथ है तो उसकी अगर कुछ पर्सनालिटी, अगर हम लोग साइकोलॉजिकल फैक्टर की बात करते हैं तो पर्सनालिटी स्पोर्ट्स पर्सन की अलग अलग जगह पर हम लोग ऑब्जर्व करते हैं, क्योंकि वहां पर उसका सामंजस्य अपने कोच के साथ, उसके फैमिली के साथ, फ्रेंड्स के साथ, टीम मेंबर्स के साथ किस तरह से है, देन वहां पर वो अपने रिलेशनशिप किस तरह से मैनेज कर रहा है. उस रिलेशनशिप मैनेज करने के लिए हमारा जो फैक्टर जो है सोशल एडजस्टमेंट. जस्ट लाइक स्पोर्ट्स पर्सन ड्यूरिंग द स्पोर्ट्स, जब सभी स्पोर्ट्स के रूल्स को फॉलो करते हुए किसी टीम में पार्टिसिपेट करता है, वहां पर उसकी स्किल लेवल पर उसका परफॉर्मेंस आता है. उसकी एक पर्सनैलिटी है जिस स्किल पर वो बहुत अच्छे से परफॉर्म कर रहा है, बट वो पूरे टीम को मैनेज करते हुए हमारे स्पोर्ट्स के रूल्स, देन कोच के गाइडेंस को फॉलो करते हुए अपना बिहेवियर मेंटेन करता है. हम लोग स्टडी कर रहे हैं इसी बिहेवियर के ऊपर कि एक स्पोर्ट्स पर्सन ड्यूरिंग द स्पोर्ट्स एक्टिविटीज में किस तरह से वो स्किल डेवलप कर रहा है, और उसका एक जो हमारा फैक्टर है साइकोलॉजी का, एक हमारे व्यवहार का जो फैक्टर है सोशल एडजस्टमेंट, वो किस तरह से डेवलप हो रहा है. और वो हम लोग कंपेयर कर रहे हैं एक अदर पर्सन जो नॉन स्पोर्ट्समैन है, उसको स्पोर्ट्स एक्टिविटीज में वो कभी इन्वॉल्व नहीं हो रहा है, किसी स्पोर्ट्स को में कोचिंग नहीं ले रहा है, पार्टिसिपेट नहीं कर रहा है. तो कंपेयर टू दिस स्टडी हम लोग पर्टिकुलर फैक्टर इज स्पोर्ट्स एडजस्टमेंट, क्योंकि जो एडजस्टमेंट वो ड्यूरिंग द स्पोर्ट्स ग्राउंड पर कर रहा है, ड्यूरिंग द कोचिंग अपने क्लब में कर रहा है, वो फैक्टर डेवलप होने के बाद हमारे सोशल एनवायरनमेंट में, अपने फैमिली रिलेशनशिप में, हमारे इंडिविजुअल रिलेशनशिप में, फ्रेंडशिप में, देन हमारे जो सोशल रिस्पॉन्सिबिलिटीज है, सोशल लाइबिलिटीज है, उसमें उसका इम्पैक्ट क्या आ रहा है, और वो किस तरह से उस जो डेवलपमेंट
इन द ग्राउंड हुआ है उसका इम्पैक्ट, वो जो डेवलपमेंट है वो सोशल एक्टिविटीज में किस तरह से वो इम्पैक्ट कर रहा है, किस तरह से वो डेवलप कर रहा है। और एक नॉन स्पोर्ट्स पर्सन है जो कि उसको इस तरह की कोई अपॉर्चुनिटीज नहीं मिली है, तो इस फैक्टर को हम लोग एक पर्सनैलिटी के ऊपर हम लोग एक स्टडी, हम लोगों ने एक डिस्क्रिप्टिव मेथड यूज करते हुए एक स्टडी करा जिसमें नंबर ऑफ 48 स्टूडेंट्स सिलेक्ट कर और उसमें 5 स्कूल्स के, सेकेंडरी स्कूल्स के मध्य प्रदेश में जो इंदौर है वहाँ पर हम लोगों ने हमारे सब्जेक्ट्स लिए, इसमें 24 स्पोर्ट्समैन लिए जो कि पर्टिकुलर किसी स्पोर्ट्स में पार्टिसिपेट करते आ रहे हैं और जो रेगुलर कोचिंग में है, और 24 नॉन स्पोर्ट्स पर्सन लिए जो किसी भी स्पोर्ट्स में नहीं जाते हैं, वो सिर्फ अपना पढ़ना है, देन अदर किसी स्पोर्ट्स एक्टिविटीज में इन्वॉल्व नहीं होते। वहां पर डाटा कलेक्शन जब हम लोगों ने करा है तो डाटा कलेक्शन में हम लोगों ने एक क्वेश्चन यूज करा, डॉक्टर मेहदी अब्दुल पाप सोशल एडजस्टमेंट स्टडी में उन्होंने क्वेश्चन डेवलप करा था 2006 में यूनिवर्सिटी ऑफ कुर्दिस्तान इराक। इसमें डिस्क्रिप्टिव स्टडीज में हम लोगों ने एक मीन जब निकाला है स्टैंडर्ड डेविएशन, तो स्पोर्ट्स पर्सन और नॉन स्पोर्ट्स पर्सन के मीन में चेंजेस आए। 16.99 मीन हमारे स्पोर्ट्स पर्सन का हाई रहा है, नॉन स्पोर्ट्स पर्सन का 6. उसी तरह से टी टेस्ट जब करा है तो हम लोग टी टेस्ट में हम लोगों ने रिजल्ट देखा है कि वो हम लोग नल हाइपोथेसिस में 0.033 रिजल्ट आ रहा है, तो वो दोनों का वो सिग्निफिकेंस नहीं है। दोनों जो स्टडी हमने की है उसमें हम लोग देख रहे हैं कि सोशल एक्टिविटीज में जो इन्वॉल्व है स्पोर्ट्स पर्सन और नॉन स्पोर्ट्स पर्सन, उन सबको क्वेश्चनर के थ्रू हम लोगों ने यस या नो इस तरह के ऑप्शंस के साथ क्वेश्चनर किया और उसमें जो डाटा एनालिसिस कराए उसमें सोशल एडजस्टमेंट पर्सन वो सक्सेसफुली जो स्पोर्ट्स पर्सन है, जो एथलीट है, जो फिटनेस एक्टिविटीज में इन्वॉल्व हो रहा है, वो प्रॉपरली एडजस्ट रहा है, वो उसका रिजल्ट बहुत सही आया है। उसी के साथ उसी बेस में जो हम लोगों ने नॉन एथलीट जो था उसी का वो सिग्निफिकेंट दोनों का वेरी नहीं हुआ है। कंक्लूजन में हम बात करते हैं तो हम लोगों ने जो सिग्निफिकेंट डिफरेंसेस जो देखा था उसमें सोशल एडजस्टमेंट और स्पोर्ट्स पर्सन का नॉन स्पोर्ट्स पर्सन के साथ में वो एडजस्टमेंट सिमिलर नहीं रहा है। आई थिंक हमारा रिजल्ट जो है कि स्पोर्ट्स पर्सन और नॉन स्पोर्ट्स पर्सन में सोशल एडजस्टमेंट का जो साइकोलॉजिकल फैक्टर है वो बराबर नहीं होता है। इट मीन सोशल एडजस्टमेंट का फैक्टर स्पोर्ट्स पर्सन का बेटर होता है अकॉर्डिंग टू दिस स्टडी। एक छोटा सा एक एग्जांपल हम लोगों ने इसमें लिया है जो अभी रिसेंटली हमारा ओलंपिक गेम्स हुए थे उसमें, जिसमें एक पिक्चर्स आप देख रहे हैं कि एक स्पोर्ट्समैन स्पिरिट के ऊपर ये 2 पिक्चर्स हम लोगों ने सेट करें। इसमें एक मैराथन के धावक है केनिया के अबेल मुथाई और स्पेन के धावक इवान फर्नांडिस। इन दोनों के इंसिडेंट भी हम सभी को मालूम है कि देखते हुए हम लोग वो विनर हो सकता था, लेकिन एक स्पोर्ट्समैन स्पिरिट दिखाते हुए उसने याद दिलाया कि अभी रेस खत्म नहीं हुई है, इवेंट चल रहा है और ये जो मेडल है वो उसने अपने साथ के जो धावक है उसको दिया। साथ ही एक हाई जंप का भी एक इंसिडेंट जो बहुत ही हम लोगों को स्पोर्ट्समैन स्पिरिट के लिए एक प्राइड देता है स्पोर्ट्स पर्सन को, जिसमें हाई जंप के जो हमारे इटली के थियान मार्को और कीनिया के इसको बाशिम, इन दोनों का जब स्कोर सही आया और जब देखा कि ये एक प्लेयर है जिसको इंजरी हो रही है और वो अगर होता तो वो भी शायद इस अचीवमेंट को ले सकता था, तो भी स्पोर्ट्समैन स्पिरिट दिखाते हुए इन दोनों ने गोल्ड मेडल को शेयर करा। तो आई थिंक स्पोर्ट्समैन में सोशल एडजस्टमेंट और साइकोलॉजिकल वैल्यूज जो है वो थ्रू द स्पोर्ट्स एक्टिविटीज एक डेवलप होती है। यही हमारे स्टडी का कंक्लूजन है। थैंक यू।
ओके, थैंक यू बलवंत सर। आपका प्रेजेंटेशन बहुत अच्छा था और आपने जो इसमें जो सैंपल्स लिए हैं वो 5 स्कूल से लिए हैं, तो
जी
उसमें कोई डिफरेंट मीन सीबीएसई एंड स्टेट बोर्ड स्कूल किया है या फिर कैसे सैंपल
सीबीएसई स्कूल से लिया है, क्योंकि आई थिंक सीबीएसई स्कूल्स में स्पोर्ट्स एक्टिविटीज के लिए डिफरेंट कोचेस होते हैं और वहाँ पर प्रॉपरली कोचिंग हो पाती है। हमारे इंदौर एरिया में काफी सीबीएसई स्कूल जो हैं वो अच्छे लेवल पर है, जहाँ पर मल्टी स्पोर्ट्स कॉम्प्लेक्स बने होते हैं। तो मेरा सीबीएसई स्कूल ही लेना प्रेफर करा।
Okay. If there is a question from audience side.
Okay.
प्रशांत गावंडे सर, आपने हैंड रेज किया है। प्रशांत गावंडे।
यस मैडम, यस मैडम।
आप अपना क्वेश्चन पूछ सकते हैं।
डॉक्टर बलवंत सालुंके सर, फर्स्ट ऑफ ऑल कांग्रेचुलेशंस टू यू फॉर योर नाइस प्रेजेंटेशन।
थैंक यू सर।
सर मेरा क्वेश्चन ये है कि जो आपका टॉपिक है स्पोर्ट्स पर्सन और नॉन स्पोर्ट्स पर्सन का सोशल जो है एस्पेक्ट वो डिफर करता है, तो इसमें आपने खेल के लिए है आपके स्टडी में, क्योंकि खेल का बहुत महत्वपूर्ण रोल इसमें रहेगा इस रिजल्ट में, क्योंकि कुश्ती का अगर खिलाड़ी या बॉक्सिंग का रहा या इसका रहा तो उसका कैरेक्टर अलग रहेगा, चेस और बैडमिंटन का अलग रहेगा। तो ये जो रिजल्ट है आपके ये फिर आपका अलग हो सकता है, खेल के ऊपर डिपेंड भी रहता है, खेल के ऊपर भी डिपेंड रहता है ये।
तो सर इसमें मैंने टीम गेम और इंडिविजुअल गेम दोनों लिए हैं। मैंने एक हॉकी लिया है जिसमें हॉकी के प्लेयर्स का डाटा मुझे इजीली अवेलेबल हुआ और बैडमिंटन के प्लेयर्स का लिया है। तो टीम गेम और इंडिविजुअल गेम दोनों लिए हैं मैंने इसमें, और दोनों से मुझे डाटा कलेक्शन करने में थोड़ा सा इजी था। और रिजल्ट आई थिंक जो आया है वो क्वेश्चनियर में लगभग स्पोर्ट्स पर्सन का एक समान ही आया, क्योंकि कुछ स्पोर्ट्स पर्सन की कुछ क्वालिटीज ये होती हैं कि बार बार अगर वो हार भी रहे हैं लेकिन अपोनेंट के साथ किसी एक क्लब में अगर वो प्रैक्टिस कर रहे हैं तो आई थिंक बार बार वो हारेंगे उसके साथ कंपटीशन में। लेकिन जब वो किसी बड़े टूर्नामेंट में जब जाते हैं तो वो एक साथ में जाने के बाद में उनका बिहेवियर वो नहीं होता है कंपटीशन का, क्योंकि अगर वो किसी एक टीम में सिलेक्ट हो गए तो वो टीम मेंबर्स की एक ऑटोमेटिकली उनमें एक बोल सकते हैं कि रिलेशन बनाना और एक टीम मेंबर के साथ में अपना परफॉर्म करना है, तो एक बिहेवियर डेवलप हो जाता है उस तरह से। क्योंकि ये जो डाटा लिया है मैंने, ये स्टैंडर्ड जो है वो 9 to 12 के स्टूडेंट्स का लिया है, तो वो एक मैच्योरिटी लेवल उनका ठीक रहता है।
ओके सर, थैंक यू वेरी मच।
Thank you, sir. Thank you for your presentation. The next participant is Rajnegi Kimta. Rajnegi Kimta, are you present?
Ma'am, sorry ma'am, there is a spelling mistake in Rajnegi. It is Rajmanti Kimta. She is in group, ma'am. Rajmanti Kimta.
Rajmanti. Okay. Sorry.
Yes. Rajmanti ma'am.
Rajmanti madam, you can
Yes,
unmute.
Yes, ma'am.
There is an echo.
सालुंके सर, स्क्रीन बंद करो इनको, शेयर करेंगे। जो स्क्रीन शेयर की है ना सालुंके सर ने, उधर से बंद करो बोल रहा हूँ।
Salunke sir, you can stop sharing your screen. Salunke sir. Rajwanti Kimta madam?
Yes, ma'am. Yes, ma'am.
You can start your presentation, but there is a echo from your side.
वो डिवाइस है उसके वहाँ, इसलिए आवाज आ रहा है.
हाँ. मैडम दो डिवाइस अगर होगा तो एक आप थोड़ा साइड में रखिए दूसरी जगह.
जी मैम कर रही हूँ मैं.
इको हो रहा है. There is a time limit.
उनको बोला दूसरे फोन से स्क्रीन शेयर कर लूं, वहां से उनको अलाउ की.
मैं दूसरे फोन से जो स्क्रीन शेयर कर रही हूँ मैम, वहां से अलाउ करना मैम.
कौन से नाम से वो है?
दिव्यांश के नाम से.
रोमी मैम.
यस.
अपने दूसरे सेशन का भी टाइम ऊपर चले गया, 10 मिनट ऊपर. तो और एक कैंडिडेट है मैम, तो इनको बस दो मिनट देंगे मैम.
हाँ
ठीक है मैम.
मैडम दूसरा ले लो, तब तक कोई होगा तो उनको टाइम लगता होगा तो.
ओके. The next presenter is जयवीर रावत.
मैम मैं कर सकती हूँ क्या मैम? राजमती.
हाँ, आप वो अपना सिस्टम थोड़ा अपडेट कर दीजिए ना, क्योंकि आपका वो हो नहीं रहा ना वहां से.
जयवीर रावत.
जयवीर रावत सर.
हाँ है मैम, वो ग्रुप में, उनको प्लीज आपको होस्ट बनाएंगे.
ओके. जयवीर सर, you are now co-host.
Yes, ma'am. Thank you, ma'am.
Your presentation and within 2 minutes.
Yes, ma'am.
भाई ये तो पंगा है, ये यहाँ से होने का है ना. हेलो, यहाँ से पढ़.
मैडम किमटा मैडम को वो कर दो, आप म्यूट कर दो.
हाँ, म्यूट कर दिए.
Ma'am, is my PPT visible?
Yes, yes. You
Thank
can
you, ma'am.
make fast, please. Within 2 minutes, you can continue your presentation.
Yeah. Very good afternoon, one all presenter here. Myself, Jayveer Singh Rawat, and I am a PhD scholar from MIT School of Physical Education and Sports Science, MIT University in Noida. Football is considered as one of the most popular sports in the world, and the concept of total football makes the game more watched and hence gain more popularity in recent decades. In recent years, new models have emerged for teaching sports, use of contextualized condition, changed sports, tactical understanding, tactical transitions, learning, and teaching distinct progression. So my topic is based on the same, that is the effect of soccer-specific drills on selected physical fitness variables. Selection of subjects: a total of 40 male football players were selected from Sports Stadium Gopeshwar, and these 40 players were divided into two groups, that is experimental and control group, and all the players were randomly selected for the purpose of the study, and the age range of the subject is 17 to 21 years. Treatment variable: a training schedule was framed as a treatment variable for 12 weeks, and the following dependent variables were selected for the study: physical fitness variables, that is agility, and to measure the agility, the t-test for agility were used, and the 3 trials were given to each subject, and the score was recorded in seconds. The explosive strength, and to measure the explosive strength, standing broad jump test were used, and again here the 3 trials were given to the subject, and the score was recorded in meters. Administration of test and collection of data. All the participants were randomly divided into 2 groups of 20 each, that is experimental and control group. The subject performed training 3 times a week on Monday, Wednesday, and Friday. Pre and post test data were collected before and after the training. Is the table 1, that is the 12-week soccer specific drills training plan, in which you can see that the training was performed thrice in a week. Analysis of data and result of the study. For data analysis, a 2x2 mix ANOVA was used as a statistical technique to find out the significant difference, and the descriptive statistic was used to describe the characteristics of data, and to test the hypothesis. The level of significance was set at 0.05 level. Here's the descriptive statistic in table 2, where the of football players on standing broad jump among experimental group is 2.30 and standard deviation is 0.093, and for control group it is 2.26 and 0.06.
Javi sir, you can conclude your presentation. Conclusion.
Okay, ma'am. Discussion of findings and conclusion. The analysis of data revealed that there is no significant difference found in explosive strength ability. This insignificant difference may be attributed because the exercise which was formulated for the training to develop the explosive strength of the players may not be effective. In order to develop explosive strength, it takes time and neuromuscular adaptability of the players that differ individual to individual. Data also reveals that a significant difference was found in agility of football players due to the better effect of specific soccer drills training. The most significant reason for this significant improvement on the agility may be attributed to the nature of movements quality required for performing the movements in football, where players need to quickly change the direction and at the same time maintaining the speed of the movements as well. It is important to develop agility in soccer players to perform the techniques with the ball effectively and in the presence of opponent. The training schedule was designed in such a way that included the maximum quick direction changing situation created in soccer drills, so that players need to change the direction as quick as possible and at the same time keeping the ball in control. That is the need of football games. Such kind of training enhances the ability of the players to apply force to the direction as quick as possible while maintaining good body balance and control over the ball. Here are the list of references. Thank you.
Thank you, Javier sir.
Yes,
Rajwanti madam, are you ready?
No,
Yes,
madam,
ma'am.
there is no more time available for us for this session. We'll
Okay.
continue. We will shift on to our next session. If there is no participant is available in that, and if we have a time slot, then only we will include this.
Okay.
Right.
Thank you, sir.
We can conclude this session.
कान्या मैडम को होस्ट कीजिए, श्री बिंजानी सिटी कॉलेज। रूमी मैडम
सिटी बिंजानी कॉलेज को होस्ट कर दीजिए।
Yes, sir. सर यहाँ शो नहीं हो रहा। Yes, sir.
Yes, thank you so much, Domibis ma'am. We'll move on to the next technical session. And we have the chairperson with us, Dr. Pradeep Kumar sir, who is an associate professor, Department of Physical Education and Sports Sciences, University of Delhi. I request Dr. Pradeep Kumar sir to take this further. Sir. Dr. Pradeep Kumar, sir. Sir, are you there?
Ma'am, he is in group. उनको प्लीज co-host बनाइए ना मैम.
Yes.
Okay. Madam, please make him host.
मैडम उनको अनम्यूट कर दीजिए.
Yes, sir. I'm searching his name. Yes, I've got him.
Yeah.
Just a second.
I think I'm unmute now. I'm Dr.
Yes,
Pradeep.
yes,
Thank
yes,
you.
yes.
Thank you very much, ma'am.
Sir, your video is not on.
Okay.
You're not visible, sir.
Now it is visible.
Right.
Okay. Thank you very much. So I welcome the 8 scientific sessions of this international conference on the role of sports psychology and fitness management for the sports during the COVID-19 pandemic era. And there are 8 participants in this evening session. So without wasting the time, you all the participants know the rules. The time period you have to stick to your timing and present in the stipulated time. And the first, I invite the first presenter, Poli Borwa, with the title is the performance of the standing long jump in the relation to the selected country for movement jump parameters, counter parameter. Okay, are you there, Poli Borwa?
So she's there.
First presenter, Poli Borwa, you have to make him co-host, then he will be able to present the PPT. I think, Tapan sir, somebody has to be responsible to take a list and according to that make the co-host. So we will be able to unmute and present in the PPT.
I am doing it, sir. The only thing is I'm unable to make anybody co-host. Because I am the co-host. Bis madam, please make me the host.
Yes, ma'am.
And the second presenter, Mr. Metre Kumar De, he will be get ready. And next is the Amarjit Singh Shasan. So in this line, they have to present their presentation. So
Romi
all
Bis
be ready.
madam.
Yes, now Poli Bora is, yes, he's made the co-host. Yes. Can start the video.
Yes, Poli Bora, you stick to your timing. Now you can present your PPT and start your presentation.
Good afternoon, all of one present in this e-conference. I'm Poli Bora. I'm a research scholar of LNAP Gwalior, and I'm ready to present my simple research work in front of you all. It is performance of standing long jump in relation to selected counter movement jump parameters. Here is the introduction. Standing long jump is a standard multi-joint exercises for evaluation of lower limb explosive strength, which is one of the determinants of success in all activities that requires a demonstration of maximum muscle force in the shorter period of time. Though this standing long jump is not reliable than other means leg strength muscle test, but we physical educationists and research person are using this constantly only because it is very easy to conduct and it is very low cost. This test has no cost, so we are using this continuously. And the aim of taking this research topic is I have studied another research topics who tried to investigated explosive movements primarily concerned with vertical jumping. Although a lot of attention was paid jumping for distance, most of these works were centered on long jump and triple jump. And means in previous studies there was not so much studies which have been done to correlate between counter movement jump variables and standing long jump parameters. That's why I have taken this topic according to my choice to see whether there is any relationship between counter movement selected counter movement jump variables and standing long jump performance. Am I audible, sir?
Yes, you are audible. You leave this introductory and some briefly you tell about your methodology variables and the test, and then you go to the conclusion, please.
Okay, sure, sir. For the means research process, I have selected 31 volunteer male athletes from Lakshmi National Institute of Physical Education, and their age range was 19 to 21 years. And for the data collection process for counter movement jump variables, I have taken Z sensor device, which was a sensor device which help us to take data through sensor our body. And the standing long jump test was measured through the measuring tape in athletics ground, long jump tape. And for the relationship, for measure relationship, I use Pearson product moment correlation coefficient as a statistical measures. And this is descriptive statistics of counter movement jump variables and long jump performance. And this is the correlation, means a result of my study. In this study, the correlation coefficient and the p-value was showing from this table. We correlated that results showed that the significant relationship between standing long jump performance and for counter movement jump variables. The detailed result was followed. Counter movement jump height and high positive. Height had high positive correlation, that is R is equal correlation coefficient is equal 0.776 and p value is equal 0.000, which is less than 0.05, and it is a very high correlation. And takeoff speed had also shown high positive correlation with counter movement with standing long jump performance, and peak speed had significant correlation with standing long jump performance, and takeoff force also had shown a significant positive correlation with standing long jump performance. And other two variables, that's impact force and maximum concentric power, has not shown any correlation with standing long jump performance. And this is discussion part. Further analysis of the relationship of standing long jump performance and counter movement jump variables revealed that a highly significant positive correlation was established among standing long jump performance and counter movement jump height. In one study, Valedictory et al. Conducted a study, and their results showed counter movement jump height as one of the main predictor of standing long jump performance, and their study supported my study very well. The result might have concluded that the higher the counter movement jump, the higher the performance in standing long jump performance. The relationship among takeoff speed of counter movement jump and standing long jump performance also had shown a good significant relationship. The result also revealed that the peak speed and the takeoff force and had also shown a positive significant correlation with standing long jump performance, and there is no significant correlation was found impact force and maximum concentric power. This is my conclusion of research. The result of the study can help the athletes and coach to improve standing long jump performance, to including the specific counter movement jump parameters in the training schedule. From my knowledge, I think because during standing long jump, the first phase of standing long jump is counter movement jump. It's a counter movement jump before we go for flight phase. It is a counter movement jump. So if we'll improve the counter movement jump performance, then definitely we can increase the performance of standing long jump. and it is a measure for leg strength, explosive leg strength. So I think that it can be helpful for the coaches and the physical education, those who want to choose physical education as a career for their selection process. That's all my research, and this is my references. Thank you, sir.
Thank you, Ms. Polibora. Very nice presentations. The questions we can take later on by email or something like, because we are lacking the time. We are lag behind this timing. So we have to present the next presenters is the Mr. Mithan Kumar Day.
Okay.
Mr. Okay, thank you very much. You can stop sharing your PPT, please.
Yes, sir.
Am I audible, sir?
Mithan Kumar Day or Amarjit Singh Shasan. The
Am I
next
audible, sir?
one. Yes, you are audible.
Okay, thank you, sir. Good afternoon to all respected teachers and participants. Myself, Mithan Kumar Roy, the student of Department of Physical Education, the University of Bardhaman, West Bengal, India. I will share my screen. Is it visible, sir?
Let it come. Yes, it is visible now. You leave the introductory part and you directly go to the methodology and conclusion, please.
Okay, sir. Thank you, sir.
Great.
Okay. My topic today I will present here a review work. My topic is yoga practice is an influential factor for reducing psychological distress and obesity. A review paper. Due to time, I have to step forward in methodology. Methodology. The study was reviewed from various articles. So the method of selection was based on those articles, and the search strategy was various websites like PubMed, Google Scholar, Sodhganga, etc. There are some work by various authors and aim and their findings related to the psychological distress and yoga, like Dambala et al. Aim of their study was review study on the effectiveness of yoga in reducing psychological distress and improving clinical outcomes. And the findings was yoga therapy may be potentially useful in improving anxiety scores among women suffering from infertility. And also there are some aim and findings from various authors related to the obesity and yoga practice, like Kumar et al. In 2018, the aim of their study was role of yoga therapy on lipid profile in patient of hypertension and pre-hypertension. And finding was the yoga therapy has beneficial effect on serum lipid levels and should be included in therapy along with other measures. There are some psychological benefits of yoga practice, like distress, decrease stress, heighten mood, curtail depression, reduce anxiety, etc. And here are some physiological benefit, like makes it flexible, makes it happier, increase immunity power, various and lot of benefits of yoga practice and physiologically. And there are some asanas which is reduce overweight or obesity, like Utkatasana, Bhujangasana, Dhanurasana, Navasana, Trikonasana, etc. And discussion and conclusion. From the review paper, we found an overall positive result. Yoga always reducing psychological distress, anxiety, etc. This result supported by Medina et al., where they got final result. Yoga encourages on the implement present candor awareness and not reaction in the face of physical and psychological discomfort, and thus emerges as a potential strategy for increasing distress tolerance. We also found a positive effect on yoga practice on obesity. We have searched many review papers which help us to draw our result, such as Kumar et al. Found moderately strong positive effect on anthropometric and self-reported variables in women with abdominal obesity. On the basis of the reviews paper, we can also found through the yoga practice in improving subjective well-being, metabolic syndrome, hand grip strength, postural stability, body mass index, waist circumference, hypertension, rehabilitation process, self-esteem, hygienic mindfulness, and mental health, respectively. So there are some conclusion. There is absolutely an effect or relationship between psychological distance and yoga practice. Also found an effect of yoga practice on obesity. Also, regular yoga practice help us to following areas: hygiene, mindfulness, decrease back pain, improves mood, decrease joint pain, increase flexibility, etc. There are some recommendation and some references. In the last, thanking you, sir, thanking you all, especially the organizing committee for giving an opportunity to present my study in this e-conference. Thank you, sir.
Thank you very much, Mr. Mrityunjay Roy. Very well compilation of the some psychophysiological parameters and some yoga latest studies. Very nicely presented here. Please, thank you very much. Then you can unsharing, stop sharing your PPT. The next presenter is Mr. Amarjit Singh Shasan. Mr. Amarjit Singh, are you there?
Sir, he is not able to present his papers.
Not able. So then we can take the next
Sir,
one.
please stop sharing. Yes.
Yes, yes, sir. Yes.
Next
Sir.
is the PU Day. PU Day.
Yes, sir.
Next presentation. Yes, okay. Yes, PU Day. You can start. And you mind your timing, please. Only 3-4 minutes.
Is it visible to everyone?
Not yet. It is not visible.
Sorry, sir.
You again try it. Be quick.
Sir, it is visible.
I think it is coming. The screen color is changed. It is not yet come.
Okay, sir.
But it is coming.
Okay, sir. So now visible.
No. There is something wrong, I think. It is not visible.
Okay, sorry, sir.
Your system on the laptop, computer, or some phone?
Sir, phone.
Actually, you should try before coming here.
Okay, sir. Okay, sir. Okay, sir.
Mr. PUD, it is not coming. Are you trying or what? So in between, you can take the next one.
Yes, sir.
Ready?
Yes, sir. Yes, sir. You call the next.
Okay.
Delegate.
The next presenter is Dr. Kedare AV. He is present here. Dr. Kedare AV. And further next is the Assistant Professor Y. Patil.
Sir, I'm unable to locate Dr. Kedare. Can PU Day please stop sharing her screen?
PU, stop sharing the screen. Next, you try on your own, then you come next.
Please stop sharing the screen.
I think she is not listening. She has gone somewhere. डॉक्टर केदार इज हियर. उनको देखिए को-होस्ट बनाना पड़ेगा. केदार.
Yes, sir. I'm trying to locate him. I want his first name.
And Y Patil. His name written here is Dr. Kedare Kedare A.V. A.V.
But I'm unable to locate him, sir. Perhaps he's not there in the.
He may not be. But next is the assistant professor Y Patil. Next is the Y Patil.
Yogendra Patil. Yes.
Yes, Yogendra Patil. Okay.
Just a second, sir.
Yes, he is in group, ma'am.
Yes, do we have Yogendra Patil here?
Yes.
We have him. Just a second, sir.
Okay, no problem.
Yes, sir, you can unmute yourself, Yogendra Patil, sir. Yes.
Good afternoon, everyone.
Good afternoon. Please mind your timing. Please start.
Okay. 1 minute. आ रहा है क्या मेरा आवाज आ रहा है?
आवाज थोड़ी सी ब्रेक हो रही है, बबलिंग हो रही है आपकी आवाज में. थोड़ा माइक चेक कर ले, अदरवाइज ठीक है. यू कैन स्टार्ट.
Okay, sir. I am Yogendra Patil, PhD research scholar and working as Professor Director of Physical Education at NASA. My topic is impact of yogasana on college going female students. Yoga is an ancient discipline designed to bring balance and health to the physical, mental, emotional, and spiritual dimension to the teacher. It's long popular practice in India that has become a more common universal dimension samadhi. Physical exercise is any bodily activity where involved body can engage in workout for various reasons, right? To the growth and development to the development cardiovascular areas, athletics, because of management also enjoyment. The yoga is that the spiritual concept, but not days. It becomes a very fashionable sort of physical exercise. Every stage individual motivated to do exercise, especially the prana and asana and meditation. आवाज आ रहा है मेरा?
आ रहा है, थोड़ा सा ब्रेक हो रही है इन बिटवीन. आप थोड़ा सा अपना वीडियो ऑफ कर ले, फिर बोल ले, थोड़ा सा शायद क्लियर हो जाएगी.
अच्छा, ओके.
Yes.
Yogasana and pranayam can improve the mental health, reduce the stress, physical effects of yoga in college students, psychological effects of yoga in college students, emotional effects of college students. There are so many benefits of yogasana and pranayam. It's yoga with the help of yogasana and pranayam to the mental health. It helps students develop awareness of their thought process and enabling them to pursue the external also because the internal word conscious mind and body. This makes students better ready to handle any trigger that sometimes call up mental diseases and negative emotions. It is also reduce the stress thanks to various reasons like anger, anxiety, and low self-esteem. It is extremely common in college students. This stress may cause many physical and psychological headaches, muscle HS, etc. On stage, college students, mental and intellectual health. University students won't always possess the required stress management and strategy. Physical activities, one coping strength that perhaps underused by many college students. Many systems review and university students having the positive. Physiological effects of yoga in college students also is there. Yoga holds potential as a self-informing, non-pharmacology method for in the college students. Psychological effects of yoga in college students. This all college students.
Okay, yes, Mr. Patel, you pre-concluded.
Okay, so yoga is very useful for the female college students in pandemic period because they can control their emotions, they can control their stress, they can control their physical activities with doing the yoga. This is my conclusion. Thank you very much.
Okay, thank you very much, Mr. Yogendra Patel ji. Good, very good presentation, but your voice was not very clear. Okay, next presenter is, I think, the Amarjit was also there in that list, and PU Day was also there. PU Day, are you ready now?
And a call from Amarjit. Maybe he is ready.
Okay. Yes, Amarjit Singh, are you ready?
Hello.
Yes, PU Day, are you ready now?
Am I audible, sir? Sir, I guess there is some technical glitch, so may I get some more time? I'm trying to fix it up, so may I get some more time for this?
सर अमरजीत सर को अनम्यूट कीजिए.
ये PU Day ready है, डॉक्टर तपन इसको कर ले पहले.
हाँ
Yes,
सर.
Yes, PU Day, you can start now.
I need some more time.
He needs some. She needs some more time.
Then Amarjit
Yes,
Singh.
sir, there is some technical glitch, I guess. So I'm trying to fix it up. So could you please give me some time?
Okay. Later on you come. Then next is the.
Thank you so much.
Amarjit, please unmute Amarjit.
Sir, I'm trying to find him, locate him. Amarjit.
I think I have seen in the list. Mr. Amarjit Singh is here.
Is Mr. Amarjit there?
He has raised the one's hand.
But now I think he is not there. Can we have Mohit Pandey?
He is Mohit Pandey.
Yes. Can we have Mohit Pandey now?
That yes, Mohit Pandey is there. Next presenter,
Yes,
Mr.
yes.
Mohit Pandey. Okay, are you ready, Mohit?
Mohit, please unmute yourself.
मिस्टर मोहित अपने आप को अनम्यूट कीजिए. आवाज नहीं आ रही आपकी.
Hello.
Yes, now your eyes clear. Now you can start your presentation.
Okay, just take yes, sir.
Only 3 minutes.
Okay, sir. Good afternoon, all of you.
Good afternoon.
Sir, my screen is visible?
Yes, visible. You start now.
Okay, thank you, sir.
You lead the introductory part.
Okay, sir. Today's my topic is self-confidence profile of national male sports person returning to sports after post-COVID-19 lockdown. Introduction. In the year 2020, March the life comes to a standstill for every one of us, including athletes. The COVID-19 pandemic saw a sudden disruption in sports activities all over the world, and its unprecedented situation has come after the World War II period. The only handful of countries witnessed and kind of competitive sports event due to this pandemic. The psychologists and training staff are worried about athletes return to the sports because they have had no training season in previous months, so the risk of injury is high due to intense physical fitness training required in the elite athletes. And athletes possess...
इंट्रोडक्टरी पार्ट छोड़ दीजिए आप, मेथोडोलॉजी पे आइए और कंक्लूजन करना है जी.
Okay, thank you, sir. Objective of the study. The objective of the present study was prepare a self-confidence profile of a elite athlete returning to sports after post-COVID-19 lockdown. Hypothesis. It was hypothesized that the self-confidence among elite
athletes returning after post-COVID-19 lockdown will be sampled to conduct the study. 100 national level sports persons from various teams and individual games were selected. The average age of these players was 24.11 years, and they have just resumed their training in anticipation with competition after post-COVID-19. The selection of the sample was purposive and comprehensive of the player from North India. Tools. The self-confidence of selected national level sports person was evaluated by Pandey's self-confidence inventory. This inventory was standardized in 1983 and it is in Hindi. There is 60 statement which is mixed in nature, that is some are positive and some are negative. This inventory is highly reliable and valid with proper statistical verification. Procedure: 100 national male sports persons were identified. The self-confidence inventory was administered with strictly following the COVID-19 protocol. The responses were scored and tabulated score of less than 23 on PSCI, means Pandey psychological, was considered as low self-confidence. Score between 23 to 37 were treated as moderate self-confidence, whereas score above 38 on Pandey psychological psychology confidence, self-confidence inventory denote high self-confidence. The frequency and chi-square test was used for data analysis. Result presented is table 1. Data analysis revealed that the majority of the national level male sports person returning to sports after post-COVID-19 lockdown and restrictions have a moderate level of self-confidence. This account of 46% of subjects, 33% of national level male sports person showed a low level of self-confidence, while only 21% of the sample self-reported a high level of self-confidence. The variation in self-confidence among national level male sports person returning to sports after COVID-19 related restriction where statistical significance P is less than 0.01. Conclusion: based on result, it was concluded that the majority of the national male sports person returning to sports after pandemic lockdown and restriction have a moderate level of self-confidence, and the least percentage of national male sports person returning to sports after pandemic lockdown and restriction have a high level of self-confidence. Hence, it can also be concluded that self-confidence in national male sports person take a beating during this pandemic and its strict protocol. It is recommended that proper psychological and physical monitoring is needed to restore the low confidence level of national male sports person through proper training and counseling regimen. Thanks.
Okay, thank you very much, Mr. Mohit Pandey. Very well.
Okay, thank you, sir. Okay, thank you, sir.
Very good. You stop sharing your PPT.
Okay, sir.
Thank you very much. The next presenter, Mr. Amarjit Singh. I think he's ready now. Mr. Amarjit Singh.
So is he there in the group?
Okay.
I cannot find him.
Oh, okay. The next presenter, Srinivasan Nalela.
Yes,
he's here.
he's there.
Yes, Srinivasan is here.
So can you tell me the next name, please?
Yeah, I'm going to present, sir.
Yeah.
Who is next in line, sir?
Dr. D and Gauri.
Okay, sir.
You find it?
Yeah, can you see my screen, sir? Hello? Can you hear me, sir?
Yes, your voice is audible. You can start now.
Yeah, this is Dr. Shri. Yeah, I'm going to present a paper on influence of small-side games on physical fitness and skill-related variables among young football players at Warangal district. This is a introduction where we know that soccer is one of the mainest component of physical fitness event, which we have all the components. Right? Even we had skill related components also in the physical fitness.
Your PPT is not visible.
Your PPT is not visible?
Yeah, your PPT is not visible.
Is it now? Is it visible, sir? Hello? Is it visible, sir?
No, not yet.
Not yet.
I think to stop sharing your screen and then only you open up this your PPT and then you share this PPT only. Then it will be visible, I think. Please open your PPT and share only that PPT. Yes, now it is visible. You leave this introductory part, you come to the methodology and conclusion. Please start.
Yeah, now okay, sir?
Yes, it is okay now.
Dr. Suvarna, I'm going to present a paper on small games on physical fitness and skill variables among young football players at Warangal district. This is what an introduction, what I said, sports, soccer is very important. Thinking of physical fitness and others related. Physical fitness plays an important role in the soccer game. And by having a strong tactics and skill abilities, with a higher general fitness is a superiority and more powerful in the games speed. For optimal
पाठवलं मेल पाठवले मॅडमला पाठवलं व्हॉट्सअपवर त्याच्या यार मी समजत नाही मला मी व्हॉट्सअप
The some other person are speaking. Please unmute those person. Yes, Mr. Srinivasa, you start. Keep going.
The selection of subject of study is 30 football players from Railway Stadium, where have been trained players in Nagpur. The selection of football players were equally divided into two groups, I-15 experimental group and 15 counter groups. The subject were tested in the following physical fitness of performance-related skill test. This is what a diagram, a design, and a diagram. Experimental group, we had small set games and a counter group of general physical fitness variables like stability variables and performance. This is what the table showing speed. This fitness test may be conducted for 15 players. Speed 30 minute dash, agility shuttle run, endurance Cooper test, and performance related test. Test on passing and receiving, passing on this sword and we have small side games. 1:2, 2:4, 4:4. This is 4 done. Data collection. Posted a great strategy was used and investigation strategy in which 30 games for players were separated into two groups on the group and experimental group. Respective players each. The experimental group undertook a small set day training group proceeding the general training. The players test on physical fitness state as said. The training program is conducted on football players in the studio in Telangana state. Totally duration of training program is 6 weeks. Days per week, usually the duration of training session is 60 days. Plus, scale for this subject to get informed the intensity and duration of exercise increased for after every 2 weeks. Increase the duration of exercise and the variations in the games. The training program started with small side games and 10 minutes session exercises. 6 week small side games including 3 versus 3 already as 4 versus 4, 6 versus 6 and variations are warm-up games, warm-up passing and moving games for positional warm-up, conditioning, passing and position, shooting, crossing and finishing. After systematic training, the post-test was restricted on the experimental group and the control group to find out whether there was a significant difference from the training, systematic training to the experimental and control group. And the T-test was applied for calculating the entire difference between pre-test and post-test. This is the table showing speed pre-test 6.972 and the post-test 4.6 and control 6.7 6.3 and agility 18.12 and 16.22 endurance 2249.75, 2249.22.57, and enabling 14.9 and 18, compassing and
Sir, I think we are running short of time.
Yes, I'm going to
Yes, we are going.
sponsor games to on top of future variables such as speed and contribution is into development to also physiological abilities affecting physical fitness and generalized adaptive football skills during a match. This fitness and physiological factors depend on not only on fitness but also on direct involvement in activity. Sponsor games training process full involvement in the ball and more opportunity to perform skills like passing, kicking, controlling, reading for the brains. It can improve and develop physical fitness and physiological abilities to adopt the football skills. During a match, the sponsor games training lead to enough stimulate for physical adaptation and physical fitness of all players can be replaced by changing the play area, encouraging players, changing number of players in each training session. As a result, on-site games training is a similar amount of time and result to requiring increase of some of the selected physical factors. In this study, it is recommended that specific training is permanent program, especially in a session. Finally, it was concluded that significant improvement of certain physical performance-related variables such as speed, agility, endurance, deadly passing, and lifting that 6 on-site games to be programmed as an effective training program of selected physical fitness.
Okay, conclude please, Dr. Srinivasa.
Thank you. Thank you very much.
Thank you very much. Thank you, Dr. Srinivasa. Very well presentation. And next is Mr. Amarjit Singh is here, I think. You stop sharing your.
Yes, sir. Yes, sir.
Yes, Mr. Amarjit Singh, you start your presentation, please. And only 3
Yes,
minutes.
sir. Yes, sir. Sir, myself Amarjit Singh from Mandal University. I am pursuing PhD under the able guidance of Dr. Shamsher sir. Today I am going to present my research paper. उसी को तो घर से जाओ ना यार उसकी यार लेना
Yes, your PPT is visible now. Mr. Amarjit, you start.
Sir, myself Amarjit Singh from Mandal University. I am pursuing PhD under able guidance of Dr. Shamsher Singh. Today I am going to present my research paper on a comparative study of health-related physical fitness component of secondary school student of plain and hilly area of Jammu. Physical fitness refers to the organic capacity of an individual to perform the normal tasks of daily living without undue tiredness or fatigue, having the strength and energy available to meet satisfactory any emergency demands suddenly placed upon him or physical fitness vigorously and alertly with energy left over the enjoying leisure time activities and meeting emergency demand. Her physical fitness referred to the organic capacity of the individual to perform the normal task of daily living without undue tiredness or fatigue, having reserve of strength and energy available to meet satisfactory any emergency demand suddenly placed upon him. The purpose of this study was to compare the health-related physical fitness component of secondary school student of plain and hilly areas of Jammu. The research was a descriptive comparative method. A total of 66 secondary school students, 33 from hilly areas, plain areas, 33 from hilly areas were selected randomly from the 8 secondary schools of Jammu. The criterion measure adopted for this study were flexibility, muscular strength, and endurance and speed. The data collection tools used in this study were sit and reach, sit-ups, 50-yard dash, data, physical fitness, component between secondary school student of plain and hilly areas, level of significance to test the hypothesis. The statistical analysis of health-related physical fitness component revealed that in the parameters
such as sit-ups, sit and reach, and 50-meter dash. Result also showed that all the physical fitness components, muscle strength and endurance, flexibility, and speeds of secondary school student of hilly area were found to be better than secondary school student of plain areas. Finally, the researcher concluded that the secondary school student of hilly area as were more fit as compared to secondary school student of plain areas. Conclusion, in the present, the result also showed that all the physical fitness component, the muscular strength and endurance, flexibility and speed of secondary school student of hilly area were found to be better than secondary school student of plain areas. Finally, the researcher concluded that the secondary school students of hilly areas were found more fit as compared to secondary school student of plain areas. This clearly shows that children of secondary school students of hilly areas as more fit as compared to secondary school student of plain areas. Thanks for listening.
The next presenter is Dr. D.N. Gauri. Madam, you find that D.N. Gauri is there?
Yes, sir, I'm here.
Okay. And the next presenter is the Shashwati Shetty. Get ready. Okay, start, please.
Shall I share, sir?
Gauri madam, you start now.
Yes, sir. Sir, is it,
yeah, it is coming.
Sir,
Yes,
is it visible?
Yes, it is visible. You start now.
Okay, sir.
Mind your time, please. Only 3 minutes. Only 3 minutes.
Yes, sir. Yes, sir. I'll run. Most respected chairperson, Dr. Pradeep Kumar and Dr. Datta sir and all the organizing committee, a warm and welcome to the good afternoon to you all. So since I'm coming from Tamil Nadu, a great scholar Saint Tirumula said, "Udambai valaten uru valaten." That means knowing the trick of growing of the body, I develop the body and develop the life. We know about yoga is a union of body, mind, and spirit, a way of life. It is conscious. It is a stilling the whirlpool of the mind. And everyone knows the views, two extreme views about yoga. Yoga is highly difficult and complex. Those who are not doing, those who are not having flexibility, and those who are having flexibility, yoga is too simple for them. And yoga is an art and science because it deals body, breath, mind, soul, and ultimately the universe itself. Sir, am I audible to you, sir?
You are audible, please. Continue.
Yes, okay, sir. And yoga is a science. Yoga practice can be used to correcting the disorders of the body and keeping the body in a healthy condition and improving mental capacities and developing the intellectual. And transformation and instant gratification. Gratification means satisfaction. Yoga is satisfying the following things. It massages all the body organs. It increases the lubrications of ligaments, tendons, and joints. And it increases the flexibility and it cleanses the body because we are doing the squeezing and yoga, that body cleansing the body, sending the lactic acids and the sweating, and increase the muscle strength and tone, improve postures and decrease the anxiety, depression, and stress. And physiological benefits. It balances the endocrinal and nervous control, and it increases the immunity and stables ANS, autonomic nervous system, and it increases the cardiorespiratory and the efficiency of musculoskeletal, and it increases the range of movement, endurance, and strength, decrease the blood pressure, heart rate, and EMG. And the psychological benefits, it improves mood and it increases the somatic awareness where the bodies, when we are doing the yoga, where our bodies are there, and kinesthetic awareness and self-actualization and social adjustment, decrease anxiety and depression and hostility. And psychomotor benefits, when we are doing yoga, it increases the grip and strength and dexterity and fine skill. Fine skill denoted the hands and fine muscles of hands and fingers. And it increases the high-end coordination and reaction time, and depth perception, and steadiness and balance of our body. And the cognitive function, it improves memory, our attention, concentration, depth perception, learning efficiency, especially when the concentration will be more, and attention power also will be more, memory power also will be more. And biochemical effects, the biochemical profile improves anti-stress effect, antioxidant, and prevention of degenerative disorders. And when we are doing the yoga, compared to sports sciences, yoga low risk of injury, sports high risk of injury, effort minimum and relaxed, and this is maximum tense, energizing activity, this is fatigue activity, and yoga is a natural and controlled breathing, and sports is a breathing in heavy and fast, and process oriented and goal oriented. And yoga only needs you and your dedication, discipline, determination. Thank you, sir. Because of time, I ran fast. So please, sorry. Thanks a lot. Thank you, sir.
So please unmute yourself.
Yes. Thank you, ma'am.
So please unmute yourself.
Pradeep, sir.
Pradeep, sir.
Okay, okay. Yes, yes. Okay, thank you very much. Next presenter is the Mr. Shashwat Shetty.
I don't think, sir, he is going to present. He is there.
And the one the missing is there, PU Day. Is she ready?
Sir, we'll move on.
PU Day is there here.
Yes, sir.
We can allow Dr. Tapan?
Yeah. Tell her to sum up first.
Yes, PU Day, you please start. Be quick.
Okay, sir.
Only 3 minutes, PU Day, you finish it. Only methodology and conclusion.
Sir, she is finding problem. We will take on later on if the time permits. We'll move on to the concluding session.
Yes, thank you, sir. Okay.
Please sum up.
Okay, thank you very much, Dr. Tapan Dattaji. And we have total in this scientific session, the total presenters were 10. Out of 10, only 7 were presented here, and they were nicely presented the problem facing during the COVID-19 era. And we can, with the help of these presentation, the finding and results, we can help to further in this due course of the time. It will help us to fight with this corona epidemic when we are remaining at home. So we can doing certain yogic or some homely type of the exercises for the benefit of the individual person. So thank you very much, Dr. Tapan Datta, all the organizers, all the presenters, congratulations, and the organizers, sir, to nicely organize this international conference. Thank you very much, sir. Thank you.
Thank you, Pradeep, sir, for accepting our invitation to be the chairperson of this technical session. Though we have the time limitation whereby we could not, but we'll see to it in our next conference. We will look into this matter so that it can be conducted smoothly. And we were not aware of the network condition in the remote area, and the people from delegates that want to present their paper. That is the very much bigger issue as far as virtual conference is there. So I, on behalf of organizing committee, thank you all and hand over the mic to Pranjal Madam to take the further proceedings.
Thank you so much, sir. Good afternoon, everyone, and welcome to this virtual platform for the valedictory function of the 3-day international e-conference on the role of sports psychology and fitness management for sports persons during COVID-19 pandemic era, organized by Nagpur Sharirik Shikshan Mahavidyalaya Nagpur in association with Shri Binzani City College Nagpur, Postgraduate Teaching Department of Physical Education, Rashtrasant Tukadoji Maharaj Nagpur University Nagpur, and Institute of Science Nagpur. After 3-day-long deliberations on this topic, I'm sure all of us would be teeming with ideas and suggestions. With 6 technical sessions and more than 20 paper presentations, we can say that this has been a successful conference. We come to the last part of the conference, the valedictory. We have with us Secretary of Krida Mandal, Honorable Dr. Suvarna Bhalerao Madam, who is presiding over the valedictory function. The chief guest of the function, Honorable Shri Vijay Munishwar sir. Guests of honor, Dr. Sujit Metre, Principal SB City College, Nagpur, and Dr. Anjali Rahatgaonkar Madam, Director, Institute of Science, Nagpur. I welcome all the dignitaries and participants to this function. To share remarks about the conference and sum up the proceedings at the outset, let me call upon Dr. Tapan Datta, officiating principal of NSSM and organizing secretary of this conference. Sir.
Good afternoon, everyone. Respected invited guests, delegates, resource persons, and dear professional colleagues. First, this conference has helped to strengthen the multilateral association, break down isolation, and build new partnership. New partnerships have been established between the colleges which have helped us to conduct this conference, with special reference to Shri Binzani College, PGTD Physical Education Department, and Institute of Science. I am very honored and delighted to deliver the concluding remark on the last day of the 3-day International E-Conference on role of sports psychology and fitness management for sportsmen during Covid-19 pandemic era, jointly organized by Krida Mandals, Nagpur Sharirik, Shikshan, Mahavidyalaya, Nagpur, City Binzani College, Nagpur, PGTD Physical Education, and Institute of Science, Nagpur. At the opening ceremony, we hope we would learn new ideas from conference deliberations, which we could adopt to further improve our work in this important area. I know that there have been many interesting and useful presentations in these 3 days of deliberations by the resource persons and delegates. The conference began on 2nd September 2021 with its inauguration in the hand of Honorable Shri Ashok Gandhi sir, President Nagpur Shikshan Mandal Nagpur, as our chief guest, Dr. Subhash Chaudhary, Honorable Vice Chancellor, Rashtrasant Tukadoji Maharaj, Nagpur University, Nagpur, expressed his unavailability to join due to Nagpur team visit from 2nd to 4th September 2021. But Sir has expressed his best wishes for the conference. Honorable Shri Adili Somariwala, President, Athletic Federation of India, also could not join due to his last-minute engagement. The President of the inaugural function, Honorable Shri Dilip Dube sir, President Krida Mandal, which runs our institute, I am thankful to him for allowing us to conduct such a wonderful 3 days international e-conference. In the opening ceremony, the keynote address was delivered by Dr. Stephen Christensen sir from School of Psychology and Counseling, Health Engineering, Science Faculty, University of Southern Queensland, Australia. I extend my heartiest gratitude to him for his excellent, thoughtful, innovative, intellectual, and research-based deliberation on the theme of conference. Thank you very much, sir. In total, 5 resource persons presented their paper during this first day of the conference, 3 days of conference. On day 1, it is in the first technical session, Dr. Sanskriti Chavda, sports psychologist from the Guardian School and Pro Health Asia, India, presented her paper on parental support to athletes during COVID-19 pandemic, sports shutdown and isolation period. The session was chaired by Dr. Suryavanshi, Director, Department of Physical Education, Rashtrasant Tukadoji Maharaj, Nagpur University, Nagpur. In the second technical session, Dr. Lalit Sharma, my friend and a professor in Indira Gandhi Institute of Physical Education and Sports Sciences, New Delhi, presented his paper on challenges facing the athletes and coaches regarding return to group training. The session was chaired by Dr. Avinash Asnare, Director, Department of Physical Education, Sant Gadge Baba, Amravati University, Amravati. On the second day of the conference, that is 3rd September, in the third technical session, Dr. Deepak Dogra, Assistant Professor from Department of Physical Education, Banaras Hindu University, Varanasi, presented his paper on role of fitness management managers during COVID-19 pandemic. Dr. Neha Arora, Sports Officer from International Institute of Information Technology, Bangalore, chaired the technical session. In the fourth technical session, Dr. Avdesh Kumar Sirotria, Assistant from Professor from School of Education, Fiji National University, Fiji, Iceland, presented his paper on role of sports psychologist for athletes to beat lockdown blues. The session was chaired by Professor of Indira Gandhi Institute of Physical Education and Sports Sciences, New Delhi, Dr. Samiran Chakraborty. The fifth technical session of paper presentation was for research scholar, and in total 5 papers were presented during this session on different aspects of physical education and sports. Dr. Amit Temburne, Director Physical Education, MB Patel College, Sakuli, has chaired the session, and the session was conducted successfully and very informative. Subjects were taken, and every delegates were enlightened with the topics that has been dealt in. Day 3, that is today, the conference begin with its sixth technical session. Dr. Binayak Kumar Dube, Assistant Professor from Department of Physical Education, Banaras Hindu University, Varanasi, presented his paper on role of yogic science in fitness management during COVID-19 pandemic. Dr. Gauri Chakraborty, again a professor from Indira Gandhi Institute of Physical Education and Sports Sciences, New Delhi, was the chairperson of the session. Seventh and eighth technical session were paper presentation for research scholars, and in total 17 papers were presented during these two sessions on different aspects of physical education and sports. The presentation demonstrated good practical activities and experience. Dr. Romi Bis, Sports Officer, J.M. Patel College, Bhandara, and Dr. Pradeep Kumar, Professor from Indira Gandhi Institute of Physical Education and Sports Sciences, were the chairpersons for these two sessions. I would like to refer also to many initiatives that have taken place. A total of 100 delegates and resource persons and more than 200 delegates attended the 3 days conference through Zoom and YouTube platform. More than 115 papers will be published in the UGC Care Listed Journal. Therefore, let me wish all of us a lot of energy, enthusiasm, shared trust, and resolve on our way towards achieving a better sports performance and health for our athletes and citizens of the country during and post-COVID pandemic era. At the end, I would like to take this opportunity to thank the principal of Shri Binzani City College of Nagpur, Dr. Sujit Metre, Director Institute of Science Nagpur, Dr. Anjali Rahatgaonkar ma'am, for joining hands with us to make this conference a grand success. I extend my heartiest thanks to Dr. Pranjali Kane, Assistant Professor, Shri Binzani City College, Nagpur, for her commitment and enthusiastic effort to make this 3 days international conference a great success. Thank you, Madam. I extend my great sense of gratitude to Dr. Sanjay Chaudhary, Sports Officer of Shri Binzani City College, Nagpur, and my co-organizing secretary for his tireless work, first to make this conference happen and to make it realistically fruitful for each and every stakeholders. Last but not the least, there is always something to be thankful for. I am thankful to all the faculty members of my college and Sri Binzani City College, Nagpur, for their tireless effort to make this conference a great success. Thank you everyone for joining us from all parts of world through virtual platform. Now I pass it over to Dr. Anjali Madam for the continuation of further proceedings.
Thank you so much, sir. Thank you so much. We have a couple of delegates who would like to express themselves on this occasion. I invite Dr. Jayavant Mane to share his experience of the conference. Dr. Jayavant Mane, are you there? He's from KMC College, Khopoli, University of Mumbai.
Yes, ma'am, I'm there.
Yes, sir.
Yeah. Thank you. Good afternoon, everyone. First of all, I like to congratulate Nagpur Sharirik Mahavidyalaya in association with Shri Binzani City College, Nagpur, PGTD of Physical Education, RTMNU Nagpur, and Department of Physical Education and Institute of Science, Nagpur, for organizing 3 days international e-conference on the role of sports, psychology, and fitness management for sportsmen during COVID-19 pandemic era. Respected all dignitaries present here, as well as all participants. Actually, this subject is very much close to the sports field and specifically for the sports performance during this time. And this institute has selected such a topic where every participant will get some or other thing where and how to work for the performance-based athletic training in different sports. Here I like to mention that just Neeraj Chopra, who got a gold medal at the Olympics, and his performance was 86.56. For everyone's information, his personal best performance is 87.80 meters. But this pandemic situation have affected in such a way that he was not able to cross his best performance during the Olympics. And sir, the organizing secretary, Dr. Tapan Datta sir, Dr. Sanjay Chowdhury sir, and Dr. Madhavi madam, you all people have took such a important topic, important subject, and given us, enlightened us all participants regarding this pandemic era, how the things are affecting on the sports performance and how to overcome on that. And for this, to make this grand success and to give a justice to this topic, you have selected all speakers, including keynote speaker, Dr. Stephen. He has given a various angles of the psychology and effects on their fitness as well as the sports performance. Even Dr. Avdesh, Dr. Lalit, Ms. Sanskruti, Dr. Deepak, and Dr. Dube, they have really given a justice to the topics and given us such a valuable information for sports field that because of this, definitely we will implement all these things in our day-to-day physical education life, and that will help our athletes, our sportsmen to enhance their performance. So I like to mention here that your organizing process, right from the registration, that was so smooth and that was very helpful for all the delegates, that wherever we find any sort of a more inquiry, you people were available for us. Not only that, you have considered some delegates, those who have a little bit delayed or they have crossed your stipulated dates which you have framed it. But you are so kind enough to permit them in publishing the paper as well as presenting their paper. On behalf of all the participants, I like to give a big thank you to you, sir. And the way you have organized all these sessions, the way you have did all time management, the way you carried out all the sessions, sir, it's a very remarkable. And special thanks goes to Dr. Tapan Datta sir, as well as Dr. Sanjay Chowdhury sir, for taking such a fruitful efforts and enlightening us with such a important topic. So thank you again, once again, all this organizing committee and supporting all management members. Thank you so much, sir.
Thank you, sir. Thank you so much for the appreciation. We have with us Dr. Meenakshi Pohuja, a well-known national swimmer and professor at Lady Shri Ram College, Nagpur, Delhi, to speak a few words, ma'am.
Am I audible? Hello?
Yes, ma'am, you are audible.
Yes, madam, you are audible.
Yeah, thank you for the opportunity to express my views on the closing of this international prestigious conference. I want to thank the organizers, the Nagpur Sharirik Shiksha Mahavidyalaya, for bringing all of us together, during this difficult time of pandemic. You took that initiative of bringing all of us from different universities, different parts of the country. We all are serving in our universities. But thank you for giving all of us this wonderful opportunity. It has really been a very enlightening experience, when we read all these news and details that people are going through so much of, mental illness, and there are issues of, suicides, and we see so many issues coming up. It's just not about the sports people or only the achievers, but the day-to-day life, our students, which are in very big numbers, going through difficult times of being depressed, not able to meet their friends, cutting off from, from their social life and personal life. It's been a very difficult journey altogether for each one of us during this pandemic, not only as teachers, but we have to, make ourselves available to counsel our students. The speaker before me just mentioned in his feedback that if we talk about an Olympian, Neeraj Chopra, who was not able to give his best performance, but there are others who strive really hard and outshine all the other. Look at our Paralympians who've broken all the records of achieving the maximum number of medals during this difficult time. So it has been a very mixed and a very difficult situation for each one of us. Professionally engaging and exchanging these ideas in this kind of an international conference where, the ideas were floated, what we can do as physical education teachers, as leaders, wherever we are, because the entire mammoth task of revival of sports lies in the hands of the physical educationists, be it at any university or our teachers being at school at various levels, our sports coaches, all stakeholders who are a part of this dynamic world of sports and physical education. So I really want to thank the organizers, and it's not only my voice that I want to express my gratitude, but I want to express my gratitude, on behalf of all the participants, because what I'm felt during these 3 days of engagement at that high level, because the papers, the presentations, and especially the international insight given by Professor Steve, all was very meaningful. So I have to thank each one of you for that, especially the organizing committee. The person who gave before me the feedback was very right from the registration. It has been a very simple, way to register, and people were there to, address our queries. And I was also among one of those whose paper was instantly selected, and you submit, and within a day, the committee gets back to you. Your paper is selected, will be printed. What a thrill, So thank you for giving that opportunity for all of us to, take it forward and share our knowledge and experience and exchange ideas. Events like these international conferences do bring, all the intellectual, engagements. And what should I say? I'm really overwhelmed with the entire experience of attending this 3 days international conference. And I'll feel in my duty if I don't thank my esteemed colleagues of physical education who took this painful and mammoth task of organizing 3 days of such a prestigious international conference. I would like to thank Dr. Tapan Datta, who is the principal of Nagpur Sharirik Shikshan Mahavidyalaya. Thank you so much, sir, for this opportunity. Then Dr. Sanjay Chaudhary, who is from Zai City College, Nagpur. Then Dr. Sujit, if I remember correctly, Dr. Sujit, yes, the principal of the Binayak City College, Nagpur. Then Dr. Anjali. Yes, we have been hearing her, and thank you, Anjali ji, for all the pain that you have taken. Then entire technical team, which has overcome all the glitches and ensured that we all are connected, though there is a lot of difficulty of network issues in the country anytime you get signed out. But thank you for looking into all the detailing. So if I have to acknowledge the technical team, Dr. Pranjali, Dr. Amit, and Dr. Suesh. So the entire technical team and entire organizing team, I may not have all the names with me, but the people I heard very often during the conference, I just want to say a big thank you. And it's really been 3 days of meaningful engagement and a lot of ideas actually floating in the thought process, what all we can do. We can probably go, few steps ahead to help our students and help our profession to revive and get back to the amazing world of sports and physical education. Thank you once again.
Thank you so much, ma'am. We have with us our keynote addressee, Dr. Stephen Christensen. Sir, would you like to say something on this occasion? You can unmute yourself, sir.
Well, thank you. I had to find my unmute button. It took me a while, having listened to so many wonderful presentations today and yesterday. Look, a couple of things. I just want to say how grateful I am to be able to participate in this wonderful e-conference. It's not just the youth and the university students that are missing social contact. It's all of us. Lecturers and physical education teachers, we're missing the world before COVID. Old and young are missing it. And for me personally, it's been a heartfelt, wonderful opportunity to be part of something wonderful. And as I said 2 days ago, vicariously, I'm in Nagpur for 3 days and I'm enjoying it wonderfully. Thank you very much, Dr. Tapan, and all of the organisers. And please, bouquets from me and my family for all of the wonderful work that you've done. And I'm sure you'll receive those from others as well, others in your institutions and other senior leaders in your institutions. But I just wanted to say for myself, but perhaps a little bit on behalf of all the presenters, new and young, young and old. It's been just a wonderful atmosphere. And I hope we can be back together again, maybe this time next year. That would be glorious. Thank you very much for the opportunity to say a few heartfelt words of thanks.
Thank you so much, sir. We'll move on. It is my greatest privilege to introduce today's chief guest, the recipient of the prestigious Guru Dronacharya Award by Government of India, Arjuna Award in Athletics and Powerlifting by Government of India, Shiva Chhatrapati Sports Award by Government of Maharashtra, one who has earned 3 gold medals, 3 silver medals, and 3 bronze medals at the international level, 54 gold medals, 7 silver medals, and 2 bronze medals at the national level, none other than Shri Vijay Bhalachandra Munishwar, sir, the great Paralympic powerlifter and athletic. Sir, we are very privileged to have you amongst us. Yes.
Yes.
Sir is working as an engineer at Western Coalfields Limited and is the president of the Maharashtra State Paralympic Association, chairman of PCI Powerlifting India, vice president of Paralympic Committee of Bengaluru, founder of Paralympic Powerlifting Federation of India, vice president of Krida Bharati Nagpur. He has organized many coaching camps and has been given outstanding sports coach award by Government of Maharashtra. As a part of his social obligation, he has organized 41 blood donation camps and has himself donated blood 111 times till date. I humbly call upon Shri Vijay Munishwar sir to share his thoughts with us today. Sir.
Thank you, madam. First of all, I'm thanking you all. Nagpur Sharirik Shikshan Mahamandal, Institute of Science and PGTD Department of RTMNU and all these organizers who has organized this 3-day international conference on sports, on role of sports psychology and fitness management for sports sponsor during COVID. Madam, I think I had missed a lot. I think I had not attended from last 3 days. So I think I had missed a lot. But whatever we have achieved and whatever we have done, that is only on because at our times there was no psychologist and all that. We were doing all the things ourselves because we are reading books, so how to keep our mental status cool, focused and concentrated, and in competitive climate also with all the enthusiasts and without any hesitation and stressfulness, without any stressfulness, and just to win. I was doing boxing also. I have just experienced. I have not read anything more, and like you all people, मैंने तो पूरा जो भी है वो एक्सपीरियंस से मिलाया हुआ है. तो एक्सपीरियंस इज द सबसे अच्छा कोच होता है जो आपको यू रिमेम्बर इट टिल लाइक डेथ. तो एक्सपीरियंस से जो मिली शिक्षा है उसी के बारे में मैं बोलूंगा. आई विल पुट वन एग्जांपल बिकॉज आई हर्ड last 2 or 3 papers, Miss Gauri and on yoga and all that. I also I'm in front of you only because of yoga. At the time of when I was 1 year old, I was totally crippled by polio, and I was unable to see T1. My mother took me to Yogacharya Janardhan Swami. She and he made me to stand before you all and to achieve all this whatever I have achieved now, only because of yoga, massage, and of course my mother was teacher and she was very good psychologist. उन्होंने मेरे मन में कुट के भरा है कि तुझे इस दुनिया को दिखा देना है कि तू कुछ है. And you are something, you have to do something, you go always positive and you have to win over each and everything. तो मुझे यही मिला था कि यही शिक्षा मिली थी कि जहां भी जाऊंगा जितना है. स्टार्टिंग में कुछ नहीं कर सकता था, उसके बावजूद my mother took me to अखाड़ा for wrestling. I was doing wrestling over there. Day by day my interest in sports increased and I day by day started after that, after wrestling, I started boxing. Then after that, arm wrestling. मैं एक experience आपको share करना चाहता हूँ एक psychology point of view, because this is the psychological topic is going on and I want to share one experience. 1986 में मैं just 20 साल का था. I was the finalist in arm wrestling. And till then, who was my opponent in my final bout was earlier 9 times national champion. He was very strong and stout. I was also strong, of course. I was also strong mentally, physically, both I was strong. My coach was Chinese. He was teaching me a lot. And my mother was also my mentor for psychological booster. So, मैं जब मेरा फाइनल था, सेमीफाइनल हुआ, सेमीफाइनल में जीता, फाइनल में गया, तो देयर वाज अ गैप ऑफ 3 आवर्स. तो मैं लंच लिया. तो लंच में पता नहीं मुझे, मैं एक कुछ थोड़ा सा खा लिया था, लेकिन एग्स आई वाज ईटिंग दैट एग्स. इन मणिपुर देयर वर वेरी स्मॉल साइज ऑफ एग्स. आई ईट अबाउट 20-30 eggs. I don't know what was the number. At the same time, he was watching me. That my opponent was watching me, and frequently he was watching like this. I thought that why he's watching, I don't know, I can't understand. But I was very clear and clean. I was not having any intention to watch him on it. तो जब फाइनल के लिए अनाउंसमेंट हुआ, फाइनल के लिए हम दोनों टेबल पे गए, तो मुझे पता वो बहुत स्ट्रांग था. ही वॉज अ वेरी स्ट्रॉन्गेस्ट गाय, मणिपुरी गाय था. ही वॉज वर्किंग इन मणिपुर पुलिस. उसका हाथ जो था वो लोहे जैसा था. लेकिन मेरी भी तैयारी अच्छी थी. मैं साइकोलॉजिकली इतना, मैं बताना ये चाहता हूं कि मैं साइकोलॉजिकली इतना स्ट्रांग था कि मुझे मारना है उसको. बस मेरे दिमाग में यही था कि मुझे उसको मारना है, तो मेरे को जीतना है. मैंने उसको एक बार डाउन करना पड़ता है, चिट करना पड़ता है उसको. तो मैंने कितनी बार किया मुझे पता नहीं चला. वो इतना जोरदार मारते गया. तो ये होता है साइकोलॉजिकल बूस्टअप बाय योर कोच और योर मेंटर, और कोई मेंटर जो होगा. तो इस प्रकार का बूस्टअप. अब देखो नीरज चोपड़ा का सर ने उदाहरण दिया, माने सर ने, कि उसका परफॉर्मेंस अच्छा नहीं आया. अपना महाराष्ट्र का क्योंकि कोरोना में nobody able to do his practice properly. Even of course swimming lost a lot because swimming pools were totally closed during this period. तो मेरे दो लड़के थे, एक दो लड़के थे, सुयश यादव करके हमारा पुना बालेवाड़ी का लड़का था. उसको प्रैक्टिस ही करने को नहीं मिला. तो भी बालेवाड़ी में he has done his practice regularly and not to that extent, but they are done. उसका परफॉर्मेंस वहां पे जाके अभी टोक्यो पैरालंपिक में सबको मेडल्स मिले. he was also a strong medal probable, but उसका परफॉर्मेंस he was unable to give his best only because of this practice. यानी मींस प्रैक्टिस जो सफर हुई उसके कारण वो हो सका. तो ये सब चीजें हुई है. लेकिन क्या है, बाकी जो है, जैसे अवनी है, जो इंडोर गेम्स थे, अवनी, लेखरा, शूटिंग वाले, आर्चरी वाले, एथलेटिक्स वाले, बाकी लोग है, देवेंद्र है, इन लोगों ने जो इंडिविजुअल गेम्स है, उन लोगों ने पैंडेमिक में भी अपनी प्रोटोकॉल मेंटेन करते हुए दे हैव डन देयर प्रैक्टिस रेगुलरली एंड प्रॉपरली. सो दे गॉट देयर हाईएस्ट बेस्ट इन टोक्यो. तो ये तो हुआ है. लेकिन एक क्या होता है कि जो हमारे जो साइकोलॉजिस्ट होते हैं, तो उस साइकोलॉजिस्ट, अभी तो साइकोलॉजिस्ट, स्पेशल साइकोलॉजिस्ट डेप्यूट किए गए हैं. वो क्या करते हैं, वो एक इंटरप्रिटेशन स्किल, उनका इंटरप्रिटेशन रहता है. वो पूरा ऑब्जर्व करते हैं बच्चों को. अभी हम लोग क्या करते थे, हमारे जैसे, मेरे जैसे स्टूडेंट है, उन लोगों को हम लोग जब करते थे तो पूरा स्टडी हम उनका करते थे, खाने पीने से लेके सोने जागने से सब तक. उसके बाद में उनको बूस्टअप करते थे. एक उदाहरण बताता हूँ एथेंस पैरालंपिक गेम्स का. मेरा ट्रेनी था, ही वाज राजेंद्र सिंह राहेलू. वी रीच्ड एट एथेंस ऑन 9 September 2004. Our event was on 21st September 2004. Suddenly on 12th September he started dysentery. Actually his body weight was 2 kg up, and whenever you decrease your body weight by 1 kg, in that proportion at least you lose 7 to 10 kg power of lifting. तो वो क्या हुआ, तो वो उसका बॉडी वेट भी वी हैव टू कम गेट डाउन, एंड साइमल्टेनियसली वी हैव टू मेक हिम फिट. डिसेंट्री भी लग गई थी. तो वो सब बहुत ज्यादा टेंशन था. और मैं उस वक्त यौगिक क्रियाएं करवाता था उन बच्चों से, डिप रिलैक्सेशन, विजुअलाइजेशन एंड ऑल दैट. दिस इज ऑल्सो फ्रॉम आवर. उसको क्या है, मेंटली हम फिट करते थे. तो मेंटली तो हम उसको फिट मैं रख रहा था, लेकिन फिजिकली ही वॉज नॉट एट ऑल फिट. At that in training he was doing 180 kg lift, and when on 16th of September 2004 he was doing just 100 kg. He said, sir, I can't even move and touch, and I can't do anything. I can't exceed the more than 100 kg. You just feel that we will not, we are not going to win, we have lose. Don't bother, just keep trust on me. I will give you all the commands. I will give some yogic treatment, visualization, sweeping, deep relaxation, all the 27 joints, and visualization of that joints, and getting that relaxed, warm, and getting out of your body, and see your body, that your body is just like a stone. And then at that time एकदम काम रहता है, शांत रहता है. उस वक्त आपको उसको कमांड देनी है, सकारात्मक कमांड, पॉजिटिव कमांड्स, दैट यू आर strong, you are doing it and you are going to win and you have been it. तो मैंने उसको सुपाइन जैसे ही इवेंट का दिन आया तो उसका बॉडी वेट तो आ गया था, क्योंकि डिसेंट्री लग गई थी, ये लग गया था, उसका बॉडी वेट आ गया था। तो उसको हमने मैं सुपाइन पोजीशन में लिटाया आधे घंटे पहले, इवेंट के आधे घंटे पहले, उसका नाम कॉल होने के आधे घंटे पहले। तो उसको डीप रिलैक्सेशन पूरा करवाया, उसका बॉडी से। उसको यही बोला था कि तुम और मैं, यू आर लिसनिंग ओनली मी, यू जस्ट फॉरगेट ऑल द वर्ल्डली ऑब्जेक्ट्स। उसको वर्ल्डली ऑब्जेक्ट्स को पूरा फॉलो ये करना है और सिर्फ मेरे की तरफ ध्यान देना। उसको किया, पूरा सुपाइन पोजीशन में लेके पूरा डीप रिलैक्सेशन किया। उसके मनक चक्षु के सामने, मन की आंखों के सामने एक पिक्चराइजेशन किया, that your name has been called, you went on you go on lifting platform, you hold a bar, referee says lift it, he said start, you started, you can come down to chest, pause, took pause and lift up, referee said rack, you rack and you won. He lift, I'm telling you, he lifted, he was unable to lift 110 kg even, he was not to move 110 kg, he lifted 157 kg there and a medal, bronze medal for India. On that basis, he got Arjuna Award. This is the way you have to boost up the psychology, mental, actually mental power ko koi सीमा नहीं है. There is no limit to mental power. Physical power, there is a lot of limitations, because everybody who is going representing his country in any Olympics or World Championship, or of course they are moreover about same physical strength everybody is having, but whoever is mentally strong and fit over there and psychologically boosted and morally boosted, only he can get medal or he can achieve. Because Neeraj Sharma, you might have seen while throwing, he had not seen that how much he was so confident that मेरा throw तो cross कर दिया, I am first. ये कॉन्फिडेंस होता है, एंड कॉन्फिडेंस क्या है, साइकोलॉजिस्ट का एक मेन काम भी होता है कि उसका कॉन्फिडेंस बढ़ाना, लेकिन ना कि ओवर कॉन्फिडेंस। कि वो ओवर कॉन्फिडेंस भी हुआ तो भी माइनस जाता है, और कॉन्फिडेंस बढ़ा के ही आप उसको जितवा सकते हो। तो ये आपका मेरे को मैं थोड़ा आई एम रिपेंटिंग माई सेल्फ दैट आई हैव मिस्ड अ लॉट फ्रॉम यू टू लर्न, बिकॉज मैं अभी भी विद्यार्थी दशा में ही हूँ। आप लोगों से आप बहुत बड़ी बड़ी फैकल्टीज यहाँ आई थी, कृष्णन सर थे, ये थे, अभी 2-3 सर लोगों के मैडम लोगों के जो पेपर्स देखे उसमें भी बहुत कुछ सीखने लायक था। क्या है, थोड़ा सा भी मिल गया, इतना सा भी मिल गया तो भी हमको आगे बढ़ने के लिए वो काम में आ सकता है। तो मैं मिस किया हूँ आपका ये पूरा सेशन। चौधरी सर ने मेरे को पहले यदि बताया रहता तो मैं 2-3 दिन अटेंड करने की कोशिश करता था, लेकिन सॉरी, तो भी कोई प्रॉब्लम नहीं। यदि मेरा कोई प्रॉब्लम रहा तो आप लोगों से जरूर, आपके फैकल्टीज लोगों से जरूर कांटेक्ट करूंगा, आपके पेपर्स देखूंगा, उनकी पढ़ाई करूंगा। तो ये बहुत ही अच्छा यानी इनोवेटिव और इंफॉर्मेटिव प्रोग्राम है, क्योंकि जैसे कि हम लोगों को हमारे वक्त ये सब नहीं मिलता था, वी वर जस्ट ऑर्फन लाइक ऑफ दिस। तो ये सब अभी बच्चों को मिल रहा है। अभी बच्चों का परफॉर्मेंस भी बहुत अच्छा हुआ है। हम लोग जो परफॉर्मेंस करते हैं उससे ज़्यादा परफॉर्मेंस अच्छा कर रहे हैं, क्योंकि ये साइंटिफिकली, टेक्निकली एंड साइकोलॉजिकली ये सब स्ट्रॉन्ग जा रहा है। और आप लोगों का यह प्रयास, जो तपन दत्ता सर, आप, मैत्रे मैडम, आप, संजय चौधरी सर, इन लोगों ने जो प्रयास किया है बहुत अच्छा है। मैं ये बहुत सराहनीय प्रयास है कि मीनाक्षी मैडम ने अभी बोला, मीनाक्षी मैडम को मैं बहुत अच्छे से जानता हूँ। मीनाक्षी मैडम ने बहुत अच्छा सराहा है कि ये सही में अच्छा कार्यक्रम था। मुझे यहाँ बुलाया, आप लोगों के साथ बात करने का मौका दिया, लेकिन मैं बहुत पछता रहा हूँ कि मैंने 3 दिन करता तो मुझे और ज़्यादा कुछ सीखने को मिलता था, और मैं और आपके यहाँ से सीख के मैं अपने बच्चों को और अच्छा कर सकता था। थैंक यू वेरी मच।
थैंक यू सो मच सर। और आपने कुछ भी मिस नहीं किया है, ये सारे जो रिकॉर्डिंग्स है वो YouTube पे इजीली अवेलेबल है, so you can share. Yes, we'll share the recordings with you, the links with you, and you can share it with your students.
Thank you, madam.
Thank you so much for your inspirational talk. We have our guest of honor today, the principal of Shri Binzani City College, Dr. Sujit Metre, with us. one who inspires others by his dedication, positive approach, and resourcefulness. I request Sir to say a few words on this occasion.
Thank you, madam. Hope I am audible to all.
Yes, sir.
Right. So my thoughts also coincide with the thoughts which are just expressed by none other than the Olympian, the weightlifter, and I think him great motivator also. 3 days, when you say international conference, definitely difference of opinion has to be the crux of the deliberations. This is number one. And when we say international, definitely we need to gather international perspectives. And from day one, we are gathering those international perspectives. And more or less, one thing is being emphasized throughout these 3 days, that is, it is not 50-50, but it is 60-40, 40 on the physical side, 60 on the mental side. And just now, sir has demonstrated us that how he has converted it from 110 kgs to 157 kgs. So it was a part of the process, maybe mental visualization and the expertise which sir must be having, and faith of that gentleman on sir, that it was between him and that athlete only, or the performer only. So the faith has to be there, and this faith as a concept comes from the psychology background only. So rather than I can say other sections of society, the sports person or the fraternity of sports need this thing in greater extent, the understanding of sports psychology to begin with. When we say that we are organizing this particular conference in the context of Corona, wherein lockdown was the keyword, right? Zero socialization was the keyword. I still remember the paper news wherein I could see that there are 2 girls from Nagpur who did not stop practice during Corona, although the entry to the ground was restricted. They have made their terrace as the ground and they have practiced there. But I still feel that not everyone in the world is so fortunate to have his or her own terrace. I'm saying this with great responsibility that most of the performers are coming from the meager background. They are not economically sound. Therefore, they depend a lot on society. They depend a lot on government and other organizations, including NGOs, for the sports-related facilities. And the country, huge country like India, I don't know the perspective in across the world. But then when it is a sports person, the sports person or sports as a fraternity doesn't get the first priority right from the school, right? And there are memes which are available on WhatsApp also, which says that we could have earned the medals. The problem was that in our PT or sports period, the match period was being enjoyed. The maths teacher could get entry into our sports class, and that is how the things are. So we are not yet serious because we have not understood the issues. But then that is the bigger aspect of it. But then when you come to the deliberations, you have understood one thing that is India and Indian heritage, that particularly so coming from yoga and meditation side, has helped the world lot, right? The world is practicing, so is India. And I think that we need to conduct more researches which are sports specific, right? So what type of, one more time, this domain of meditation, yoga and naturopathy, this is a huge domain. You need to identify what suits what. And I think that the international conference, the real task starts when it ends, right? So at the end of the 3 days, the researchers will one more time gear up for the next conference. They must have got the what you can say, the topics or the areas where they can research. And I hope that the success of the current conference does not depend on what happened in the conference, but then it is decided on who else got the what you can say, way or light or the direction for doing further researches. So I hope that that will be taken into consideration when Kane madam is saying that it is available on YouTube. Definitely those who have missed it, they can definitely visit it, and the deliberations should start from this day, not end. With that, I end. Thank you.
Thank you so much, sir, for the inputs. We also have with us our second guest of honor, Dr. Anjali Rahatgaonkar Madam, who is the Director of Institute of Science, Nagpur. She was the Joint Director of Higher Education, Nagpur from 2015 to 2018, Director of Institute of Forensic Science, Nagpur, and she's a member of Board of Studies, Nagpur University. I call upon Madam to express herself on this platform. Welcome, ma'am.
Am I audible?
Ma'am, we cannot hear you properly.
Am I audible?
Now you're audible. Can you be a bit louder, ma'am?
Actually, today we are conducting MPSC examination there, and the jammers they have put over there. So
you're audible, ma'am. You can. Yes, ma'am. Yes, ma'am.
So first of all, good afternoon, everybody, and all the dignitaries of the national and international level, especially the Mr. Stephen, who is I could see a faculty from the international faculty. So namaste, all of you, and on this conference, that is the International E-Conference on the role of sports, psychology and the fitness management for sportsmen during COVID-19 pandemic era. That is organized by Nagpur Sharirik Shikshan Mahavidyalaya Nagpur, Binzani City College. It's a mains college, I think, and the PGTD of the Physical Education of the Rashtrasant Tukadoji Maharaj, Nagpur University, and our institute, that is the Institute of Science, Nagpur. So first of all, my special thanks to the organizers, Dr. Tapan Datta, Principal NSSM, Dr. Sanjay Chaudhary, Shri Binzani College, and Dr. Madhavi Mardikar, she is a Director, Physical Education of Institute of Science. And also being a host of institution of this conference, I congratulate to all participants over here. Dear all, as on today's scenario, we know that the COVID-19 pandemic has brought this fast moving world to a standstill. This impact of this pandemic is very massive and only strategic to curb the rapid spread of the disease is to follow the social distancing. This imposed lockdown resulting in the closure of the various businesses, various activities, that is the public places, fitness and the activity centers, and overall a social life that is hampered by many aspects of our lives of the people, including the routine fitness activities of the fitness freaks. Then which has resulted in the various psychological issues and the serious fitness and the health concerns. So at the outset of this, many of us, the regular fitness workouts at home during this period, which greatly helped us to overcome the psychological issues and the fitness concern. First of all, I must congratulate for the organizing committee for this wonderful conference, and you have highlighted this issue in such a way that that everyone will be benefited due to this conference. As we know that the sports, particularly the team sports, which engender purposeful and the meaning of the social relationship. So I would like to thank the institutional leaders, the organizers of this 3-day conference for inviting me as a guest of honor and for giving me an opportunity to share my views with you. So thank you so much. Thank you once again.
Thank you so much, madam. Yes. Thank you very much, ma'am. We also have with us our own Dr. Suvarna Bhalerao, madam, President of today's function and Secretary of Krida Mandal Nagpur and Joint Secretary of Maharashtra Krida Mandal Nagpur. Madam has been a part of SB City College for 36 years. She was also the honorary HOD and coordinator of PGTD of Physical Education, Nagpur University, Nagpur, and worked as principal of Bhalerao Deshmukh Sharirik Shikshan Mahavidyalaya, Nagpur. She has been instrumental in organizing Ashwamedh state and intercollegiate tournaments and has received many awards for her outstanding contribution to sports. I humbly request Madam to speak a few words on this occasion.
Thank you. Thank you, Anjali. Good afternoon, everybody. Namaskar. Respected dignitaries of this concluding function, Chief Guest, Honorable Vijay Munishwar, and Guest of Honor, Sujit Metre, Principal, SBCT College. First of all, I want to congratulate both of these personalities. Like you, sir, Honorable Vijay Munishwar, the flag bearer of Indian para powerlifting, the teacher and guru, has been awarded the Dronacharya Award of 2020. Secondly, Dr. Sujit Metre for taking over the charge as principal of my institution, that is SBCT College, which is my mother institution. I served there for 36 years of my life in your college, sir. So I must express my feelings for both of you and wish you good luck for your near future. I am happy to know that SBCT College, PGTD, Institute of Science, headed by Dr. Anjali Rahatgaonkar, though they are having science, arts and commerce colleges, they joined this mega event at the keen interest for the success of this e-conference. Dr. Sanjay Chaudhary and Dr. Mrs. Maharaj, both are my successors. I really feel proud for them. Dr. Tapan Datta, with these two guides, completed the task so nicely. Selection of the subject and other themes are extremely vital for our profession and today's situation in the world. International e-conference on the role of psychology in fitness management for sportsmen during COVID-19 pandemic area. Friends, today's sports are not fun or just a play of muscles. Now sports is a challenge, tough competitions, adventures too. So athletes have to overcome all the hurdles on their path. Sports psychology as a science made tremendous progress in recent years. It helps to keep you away from negative emotions like fear, anxiety, revenge, frustration, stress, pre-competitions, post-competitions, and during competitions. So you can easily remove these negative emotions by readjusting your attitude. Sports violence is one of the most burning issues in our fields. This is only because lack of emotional stability. Yoga not only gives you physical fitness, but body-mind coordination, purification of thoughts, and fullest harmony. For good life, find ways to change your world. Accept the things which you cannot change. Have courage and wisdom also. Have patience and tolerance also. You will definitely get success. Your hard work, sincere efforts, and regularity will help you to give utmost performance. This was the exciting occasion for all of us, particularly keynote address by Stephen Christians, led School of Australia, Psychological School of Australia, technical sessions which dealt with various aspects of sports and physical education. All the speakers showed their deep knowledge of the subject and their academic excellence. They presented their papers with zeal and enthusiasm. Dr. Sanskriti Chabra, Dr. Deepak Kumar Dogra, Chinku Kumar, Dr. Avinash Hasnare, Dr. Suryavanshi, they articulated views a convincing manner. I give a word for appreciation to Dr. Anjali for having good comparing. I thank the organizing committee for giving me this opportunity to share my views with you all. I thank President of Krida Mandal, Honorable Dilip Dube, and members of Krida Mandal, Institute of Science, Nagpur Shikshan Mandal, for their cooperation to make this conference a grand success. Day after tomorrow, we are having Teachers' Day. So I wish you all happy Teachers' Day. Remember your teachers, gurus, and pray for them. Lastly, I have to say, for you to note, life is race. Everybody has to face. Who will win? No one guess. Life is best. Don't let time waste. Take a rest. Wish you all the best.
Wow.
Thank you. Thank you very much. God bless you all. Thank you, madam. Thank you. Okay.
Yes.
Thank you so much, ma'am, for your guidance and for your blessings. And with this, we come to the end of the valedictory function and also to the end of the 3-day international conference. To propose a formal vote of thanks, I now invite Dr. Kumkum Boratkar, Associate Professor, NSSM, Nagpur.
Thank you, madam. Thank you, madam. Namaskar. I am Dr. Kumkum Boratkar, an Associate Professor at Nagpur Sharirik Shikshan Mahavidyalaya. I am glad and feel great to be here today for vote of thanks for this closing ceremony of 3-day international conference on role of sports psychology and fitness management for sportsmen during COVID-19 pandemic era. On behalf of the organizing committee, I thank our chief guest of this program, Shri Vijay Munishwar ji, who is Dronacharya, Arjun and Shiva Chhatrapati awardee. Our guest of honor for this program, for accepting our request and sharing his valuable time and thoughts with us. Thank you very much, sir. I thank Dr. Suvarna Bhalerao, Madam, Secretary of Krida Mandal, Nagpur, for being with us as a president of this program and gracing this ceremony. I thank our guest of honor, Dr. Sujit Metre, who is principal of Shri Binzani City College, Nagpur, for all his wise suggestions and support. We are thankful to our guest of honor, Dr. Anjali Rahatgaonkar, Madam, Director of Institute of Science, Nagpur, for all her cooperation and support. I thank you, Madam, for gracing this occasion. Now I thank Honorable Dilip Dhabe, sir, President of Krida Mandal, who helped us through his valuable suggestions, finance, and facilities to make this conference a great success. I thank our chief patrons, Honorable Shri A.K. Gandhi, President of Nagpur Shikshan Mandal, Nagpur, and Honorable Dhananjay Mane, sir, Director of Higher and Technical Education, Pune, for their moral and all other supports. I thank our keynote addressee, Dr. Stephen Christensen, and all our resource persons from various countries and India for making this conference rich by sharing their knowledge. I also thank all paper presenters as their studies have given us intellectual food for further research in this field. I thank organizing secretary, Dr. Dhananjay, Dr. Sanjay Chaudhary. I am very sorry, Sanjay. Dr. Sanjay Chaudhary of Shri Binzani City College, who was always there whenever we needed him for preparations of this conference. We thank Dr. Pranjali Kane of Shri Binzani City College, Nagpur, who was here for all these 3 days with her graceful comparing for this program. We are thankful to our technical team, Professor Suyash Pandagade, Dr. Amarkant Chakole, Dr. Amit Tembhurne, and Dr. Praveen Kumar for their technical support and arrangements. Our very big thanks to our principal and organizing secretary of this conference, Dr. Tapan Datta, under whose able guidance, we all could give our best to make this conference a success. I thank all my colleagues of Nagpur Sharirik Shikshan Mahavidyalaya and Shri Binzani City College, Nagpur, who worked in coordination for making our conference a grand success. I thank all my dear students who supported and worked with us for this program. Finally, I thank all of them who directly or indirectly helped us for making this program a great success. Thank you.
Stephen sir, please give your number.
Thank you, ma'am.